Okay, looks like we're on. And we're gonna open the meeting this morning. This is pretty much a budget meeting work session. However, we do have a few commissioners' issues. So we have an agenda here. And we will have some public comment at the end because of that. Let's see, our first. Start with our minutes from 3/24 and 3/26. I had maybe had one.
And you removed a word.
A word or something. Yeah, the word is.
I didn't have any.
On the 24th, I thought I had one, but I learned a new word, that was in,
Oh,
the
nice.
in the,
Saw that.
maintenance report.
What was it? What was
Um,
the new word?
it was a new definition that when, Mr. Oakes was talking about the sump cover being
Ah.
up, and it was proud, and I said, is it supposed to be protrude or something? And, Sam asked, Mr. Oakes, and the definition is proud is something that in mechanics that's
Right.
pushed up above, so
Wow.
I
Yeah.
didn't, because I did not know that, so I learned that. So I had no corrections to that one.
So are we doing these separately?
Sure.
Okay, so motion to approve the minutes from 3/24/26 as amended.
Second.
All in favor?
I,
Motion passes. And let's take up the minutes from 3/26.
I didn't have any.
I had one thing, under, Sheriff Meyer, she was talking about grants, and it's, it's a marijuana eradication grant instead of a marijuana ratification grant.
Yeah.
Oh. That's important. Thank you.
Is there anything else, Sam?
And that was all I had.
Do you want a motion?
Yeah.
Motion to approve the minutes from 3/26/26 as amended.
Second.
And all in favor?
Aye.
Motion passes. What,
Your abatement?
I think we're gonna, health insurance?
Oh.
Yeah, I just wanted to
Yeah, that kind of it.
go over the information that I had sent to you on health insurance. We are Karen and I put together some different options for the health insurance, and as I
Sentence. You sent us something on 3/27.
So we currently have, as you know, two different health insurance plans through Health Trust, which is Anthem Health Insurance Coverage. We have a higher cost plan, which has a $1,000-3,000 deductible. And right now, the employees either pay 15% or 20%. Depending on their date of hire. We have 13 employees left that pay 15%. I think that date of hire is 2003. That's the cutoff. And their plan is increasing 16% for 2027. The lower cost plan, which is called the ABSOS plan, has a $9,000 deductible. Employees currntly contribute 10% of the premium. They also receive a $500 contribution to a flexible expending account, and the county pays the first 50,000 of their deductible. That plan is increasing 25.9% for fiscal year 27. So I sent you a breakdown, and the increase for that, for our current plans for next year with no changes. In the budgets that have been presented to you, it increases $1,018,890 or 22.4%. So the first thing we looked at was keeping Health Trust. And how do we make that more affordable for the county, the taxpayers. So we looked at, raising the co-pays on each of the plans. So the SOS plan, the copay would become 15% from the 10%, and the higher cost would become 25% of the higher cost plan. We would do away with the $500 FSA contribution, but we would continue to do the HRA to pay for the 50% of the deductible. By doing that, it brings down the cost in the proposed budget by 400,000 and some change. And it would leave a 13.5% increase for health insurance costs from what they currently are sitting at right now in the proposed budget that you have. On Harvard Pilgrim, we did receive, a viable option from Harvard Pilgrim. They mirrored the same plans that we currently have, as close to that as they could be. And then we would also look at increasing the co-pays as well. So be 15% for the lower cost Harvard Pilgrim plan and 25% for the higher cost. The Harvard Pilgrim higher cost plan and the Anthem higher cost plan are identical in price. They're a few cents off on each plan, so there is no savings in us changing from Anthem to Harvard Pilgrim on the higher cost plan. Savings comes from the lower cost plan, because there are, Harvard Pilgrim lower cost plan is less expensive than the Anthem lower cost plan. Right now, everything we have is bundled through Health Trust, so like the FSA and HRA admin costs, the COBRA fees and the EAP costs are things we don't see separated out. If we switch to Harvard Pilgrim, we would be going Harvard Pilgrim direct, so we would have to contract those services from other providers, so there would be separate costs which are added into the spreadsheet that I had given to you just to demonstrate that. The other thing that Harvard Pilgrim has done has offered us a $90,000 premium credit in order to obviously entice us to switch to Harvard Pilgrim. They've also done a rate cap of 15% for year 2 of the for year 2. If we switched from Health Trust, we are gone for 2 years. That's their rule. You can go back for 2 years, so I'll be able to go back to Health Trust. So in doing that, it would bring it down 700,000 from what's in the proposed budget, which is about a 6.4% increase over 2026. So this information, we had a union meeting yesterday with the United Electric Workers to represent the nursing home employees, and presented the information to them. And the information was given to the employee council, and Karen and I have a meeting with them this afternoon just to answer any of their questions. So a decision has to be made for April 30th. If we're switching, Health Trust has to be notified of that before May 1st, and retirees have to be notified. Letters have to be dated April 30th. So we'll be looking for feedback from the employees for that time frame. Decision will have to be made by the board. For the
So we have a couple of weeks to make a decision to get the feedback.
Yeah. Obviously, we have a month till April 30th, so we meet again with the union on April 15th. And hopefully the employee council will be able to set up a meeting with their employees next week and get have some feedback ready for us by that point in time as well. So when you have your, in one of your first 2 deliberative meetings, we'll have to discuss it and come up with a plan for what the next steps will be. Okay, so.
Do you have any idea, and I'm just naive about this, the school trust issues that have been going on and the costs of those based on the Secretary of State's work and enforcing that they have to have not a risk pool. I think it's a risk pool actually, right? That they have to have a
Right,
certain
so-
amount. Is there anything like that going on with health trust that we should be aware of?
Yes, which is why we see the increase in rates, because they're a different type of risk pool than school care or interlocal trust who went out of business. Um, so health trusts has to build their reserves by increasing premiums, so that's in part why our rates went up as much as they did.
And they have to do that in a certain amount of time.
I don't know specifically what the parameters are for them, but they are impacted by the whole risk pool thing that's going on with the state legislature.
Okay.
Harvard Pilgrim Direct obviously doesn't, it's not a risk pool, so we're being pretty much rated on our own. So that's what's going on, and I will plan to update you again when we meet in a couple of weeks.
Thank you. Thank you. That's really good information to have.
Oh, and it's also good that we did get another, insurance proposal.
Because United Healthcare declined to quote us, Anthem declined to quote us, Anthem Direct
Right.
declined to quote us, so we were happy that we did receive a viable option,
Yes.
stay fully insured versus going self-insured, because we've done some pretty thorough exploration on that as
Yeah.
well, and Karen and I aren't comfortable. And they're not a savings, so not comfortable making that recommendation at this point.
Yes. Okay, I think it's wise. I don't know. I just hear that that's hard to get back out of. Honestly. And we don't really have the full risk, our own sort of funds to back that kind of move up.
Right, and I feel like the first year especially, it's really risky, and I
Mhm.
don't, where we do have a viable, fully insured option, and we can also make some tweaks to what we have. I feel much more
Yes.
comfortable with us.
Because one devastating illness of an employee is, when you're self-insured. Is more, it's devastating financially as well as for the person.
To hear you. All right, so let's move back to the top of our agenda. And Administrator Laborie's here, if you want to join us at the table and.
I told them what you had going on. so.
So just for our purposes, is it in the book or the one you sent us that we're looking at? What are we?
It's both.
In the book, all right. This is always one of the most fun.
You say that now.
Interesting. It's
Interesting.
one of the most interesting.
Things,
Yeah. Yeah, it's
But-
really,
things going smoothly thus far,
Um,
or tell me that this afternoon.
yeah, for the most part, there's so the state survey team is here, and so there was a lot of discussion yesterday about the water management program that we have in the nursing home, and specifically how we're cleaning and maintaining our humidifiers that residents have in their rooms. So we've identified a opportunity to improve our documentation process on that visually, and everything is being cleaned. It's just that we're not documenting appropriately. So there was a lot of running around conversations, getting manufacturer instructions and whatnot of, yeah, so but
Some of what was going on with Jim when we were having our meeting.
correct, yes, yeah. So, but otherwise, yeah, I think things are going fine so far. So, yeah, so we'll see what happens this afternoon when they take off, so. So I'm here to present the fiscal year 27 budget for the nursing home. I would like to start off on the census revenue page there, that looks like you guys all have. So our assumption for this coming fiscal year is to maintain the average daily census that we budgeted for this year of 124 residents. Just kind of based on how the current fiscal year is operating, where we've had that ability to maintain a bit higher of a census through a good, at least the first 6 months. the fiscal year, and then running into the lulls that the dip in census that I've been explaining over the last couple of months due to sickness. I think on average, that's a realistic census for us to continue to try to plan for and shoot for. We have within the 124 average daily census, we do have a couple of changes as compared to this current fiscal year, and that's trending based on what we're seeing right now within the different payer classes. We are budgeting for one additional private pay resident. So instead of 21, we're planning on having 22 private pay residents. We are not making any increases to our private pay rates. We're going to maintain those as they are right now. I do feel that that's important to do, especially just given the additional kind of focus that was put on the proportionate share program last year in regards to having rates that are below a 60% threshold for costs. And so if you were below that, there wasn't no concern, but if you were above that 60% threshold, that created some potential reimbursement issues for some of the counties anyway that did rise above that percentage threshold. So for us, we're below that, and it just continues, I think, to be a good rate to be charging at this point. We are lower than our peers in the area, but the way I've always looked at it is it stretches out at individuals' private pay resources versus just charging more upfront and having those private pay resources dwindle. The other thing that we're planning to do right now, and this is in regards to the Medicaid rate for New Hampshire, we are budgeting a $4 decrease from what we planned for this current fiscal year. The reason for that being what we experienced with the proposed January rates and the very steep cuts that Grafton County Nursing Home originally was faced with, a $10.43 hit. What this rate does is brings us to right in that ballpark of where we would have been had there not been supplemental monies identified at DHHS to transfer over to the rates. And so it's an extremely cautious approach to the Medicaid budget this year. I'm optimistic that that's not going to be the case, that we are going to have a higher rate, but if anything, that gives us a little bit of good news in the budget, if you will, when it comes to July 1st rate calculation. So I thought it would be more beneficial to Grafton County to plan on having a lower rate.
I
and then
appreciate
take the
that.
surprise
Thank you for that.
that does come through. For Vermont Medicaid, we are also increasing one resident count there. So we have, while we still continue to have one resident pending right at the moment, we have been in that 22 range for Vermont Medicaid when you factor in the pendings that will eventually get resolved. So we felt like that census was a good number to shoot for there. And we are continuing to maintain the rate of $569.29 for the Vermont Medicaid recipients.
Can I just go back to the New Hampshire ones?
Sure.
What's the rates are the same, but we have different days or whatever.
It's broken out through the year, so it's kind of the first 6 months and second 6
Okay.
months. That's what the different lines are there. On the VA side, we're planning to maintain the current census projection of 8, but we do have a benefit that has come about from a new contract that we entered into with the VA. They've and that's going to kind of tie into some of the other discussion that I get into in the expense side of things, but under this new contractual agreement that we have with the Veterans Administration, it's a streamlined process, and it actually improved the rates that we were receiving for reimbursement. So we're actually an average rate for veterans that we have right now, we're planning on $545.17. That's a $55 increase from what we were receiving under the previous agreement. So that's something that's certainly working in our favor there. And on the Medicare side, that continues to be with an expected average daily census of 4. That's kind of right what we're seeing right at the moment. The average rate for a Medicare recipient right now, that's on a Part A stay. We are increasing that just based on what we've seen this year. So the average rate that you see there is $655 a day. And that's an additional, that's an increase of $35 from what we had currently planned for this year.
Now, these are mostly rehab.
Correct.
And so the acuity level is higher or where the work is.
It depends. It's really, when it comes to that, it's how many services the resident might need. So whether it's physical therapy, occupational therapy, or speech therapy, if all 3 are in there, the rate is going to be higher versus if it's just 1 or 2 disciplines. So, but on average, that's what we've been seeing through our Medicare billing.
The questions?
So just to kind of run down, I just wanted to talk for a second about the pro share revenue on 5020-108. You'll see an $800,000 decrease there. So that, I think, is more in line with what we're going to be projected to see going forward for Medicare, or I'm sorry, for proportionate share payments. I think we did have, as Julie knows, some swings in our reimbursement that we had received through the pro share payment. And I think that's anticipated to level off this year. And so I think that 1.8 million is in that general vicinity of where we're going to be, what our payments are going to be going forward. So. And that's just trying to reflect that a little more accurately in the planned budget. So if, I think there's opportunities there. I know we're anticipating a 2% reduction in revenue from our fiscal year 26 budget. But, again, you're factoring in the Medicare or the proportionate share payment decrease there. So there's the opportunity to have a little bit more there potentially, but I think we'll make that up through our census. I think that's going to be the biggest thing for us, an ability to maintain a higher census, but above that 124 target. So I do think, although on paper it's showing a 2% reduction, I'm optimistic in our ability to try to run a stronger census and keep those numbers higher between the different payer classes. So.
Thank you.
Great. That was a very clear explanation. So thank you.
So heading over to the expense side of things. I've been trying to rehearse this in my head about how I wanted to present this to you, because there's within this budget, there's going to be expenses that you see on the expense side that also correlate to the capital requests for the nursing home. And so if you don't mind, I'll blend a little bit if I can. I don't want to confuse, so if I am, please stop me. But one of the things that we're trying to do this year is to create some efficiency through the use of technology, specifically with programs. And so I had referenced the VA contract that we have. And we're also looking in regards to some new technology in the dietary department. So I'll be talking about that as I kind of go through the administration budget here. The budget that you see when it comes to salaries, they include the cost of living increase of 3.03%, as well as step increases. So that's factored in there as well. They're really from a standpoint of, the first page, there really isn't anything, to kind of highlight here. Um, so I'm happy to answer any questions that or things that have caught your eye. Um, I mean, you do see, on 5100 360, you do see an increase of $6,000 there. We've determined that we're doing a lot of additional color copying. That is driving that cost up, through the use of toners, and office supplies. So we're gonna be putting steps in place to not copy as much and, really trying to, utilize, PDFs, and sending out PDF emails going forward to staff when it comes to, quarterly, updates of the nursing home through our Clarion, newspaper or our, newsletter that we send out and other things. So we're going to be trying to cut that expense down and bring it back into what, kind of what we've been, had planned for in the fiscal year of 24,000.
I imagine residents prefer things printed.
They do, but we as staff that have access to email don't need the printed ones as well. And I think those are some of the opportunities that we're going to look to streamline, because that number kind of stuck out as a real opportunity to make some
Yeah.
savings there. So
Quick question. So what is the color printing primarily for?
it's for any postings that we
Yeah.
do for, if there's in-service trainings
Yeah.
or, we have a joy committee that we're doing here. in
Yeah,
nursing
it's people-
homes to try to, for morale purposes and everything, color postings for that.
Yep.
We have, like I was mentioning, the Clarion, newsletter
Yeah,
that
that-
goes out.
Mhm.
We all get copies of that in our mailboxes,
Yeah.
but we all have email addresses
Right.
that could
Okay.
just be PDF too. So those are the things that we're gonna be working
Thank
on
you.
to try to make up some savings there, so. So if we didn't have any questions on the first page, we'll go to page 2. And this is where I wanted to kind of spend a few minutes talking about some of the programs that we're proposing to implement this year. So specifically on 5100 980. The first one that I wanted to kind of highlight is our Inovalon billing and scheduling. So Inovalon is the company that we work with for our Medicare billing, and they also run our scheduling software that we use in the nursing department and dietary department. Specifically, what we're looking for this year is to add a new managed care billing component to that. We certainly are continuing to see rise in managed care referrals. And we know, and you guys are well aware of some of the struggles that come with whether you've heard it anecdotally or experienced when it comes to billing with managed care companies. What this program essentially does is works as a kind of like a scrubber, a claim scrubber, if you will, so that when we're submitting a claim to a managed care company, it goes through an algorithm and identifies any potential issues that would result in the claim getting kicked back. So it will allow us the opportunity to fix before we submit. And this is going to be very important when it comes to the Veterans Administration agreement that I talked about. So that is all going to be done through an online submittal process. It used to be kind of paper-based, which would result in delays in reimbursement from the Veterans Administration. So currently we have $300,000 still outstanding in reimbursement that's owed to us from the VA. This right now is going to result in an ability to get about a 2-week turnaround time.
Yes, it's
through
gonna
that
reduce
new-
time.
Yeah, yeah.
Mhm.
So that's going to help out quite a bit. And it's really going to free up more time for the finance department to explore working with managed care companies that we currently already aren't contracted with. But also, you know, like I said, and when we do get into contracts, it will just help with an efficiency of processing claims and hopefully allowing for much timelier reimbursement.
They are really sly, aren't they?
Yes, yeah.
And having to appeal something is so timely.
Yes.
You know, it's just so time, it takes so much time.
Yeah.
Like a worthwhile
Mhm.
process to.
Scrubbing. Yeah, yeah. Do it right the first time, huh? Yeah.
The other major piece to this line that I wanted to highlight is the reference that you see to mealtime solutions. So we, this current fiscal year, went with this meal software program for the dietary department. And so what we're proposing to do this year is to kind of increase the package offering. And what this upgrade will do will allow for the dietary department, the director, as well as the assistant director to be able to make changes within the system that will automatically be reflected on our, on the resident's record. Specifically, it's going to eliminate having to do double documentation where changes that are made from a diet standpoint would then subsequently have to be entered into on a meal ticket program where we would be printing the meal tickets out and then having to, you know, essentially cut them with a paper cutter for every resident in the building. So on average, when you have 124 residents, there's a lot of time, resources that go into making sure that the dietary staff working on the floor have the accurate information of what the residents' diet restrictions are, what they ordered for breakfast, lunch, or dinner. This program is going to make that streamlined so that it's all done right from a computer. And we're going to be having video monitors at the serving stations. That when a change is made on a computer, it's going to automatically be corrected and displayed on those video monitors going forward. So we're going to save on the labor of doing the double documentation. And we're going to save on resources when it comes to, you know, the amount of paper and copies that we're making on a daily basis. You factor in 124 residents, 124 sheets of paper, 3 times a day for meals. There's a lot of paper that gets generated and time that's spent by the dietary department doing these things. And so this is going to streamline that process and just make it a lot easier and more reflective in the moment. And it'll allow for the staff to be operating on the most current information. The other piece within this program that I wanted to highlight too is there's a point of sale option that comes with this program. And essentially what that means is when our staff are current process right now, when our staff are purchasing meals, there's a checkoff sheet that I would go for. I would look for Craig Labor. I would say, you know, on April 2nd, I'm buying lunch. And so that serves as a notice to deduct $3 from my paycheck for that day's meal. And so staff do that throughout the course of a week. And at the end of the week, our administrative assistant takes that information, tallies everything up, and then at the end of the payroll period, we'll submit 2 weeks worth of information to payroll to do the deductions of any meals that were purchased for. This new program will result in it being all done electronically, so that it's going to be done in everything will be sent over in a CSV file to payroll. So it can all just be incorporated in by whoever's processing payroll, and those it's just going to streamline it and make it more accurate as well. And it'll save time from the administrative assistant who ends up spending about 3 hours over the course of a payroll period doing that documentation or checking of you know, who signed off for meals and you know, putting that into a separate file. So so we think that, you know, again, it's something that's gonna create efficiency and it will be better in the long run for us, as for operating our meal service program for staff, so.
It's a question on the breakdown. And this is very helpful. So the managed care billing, and these seems like very good changes, is 29,000. And then
That also includes our scheduling component as well.
Yeah.
So if you look just at the managed care billing piece,
mhm.
we are looking at $1,554.
The only question that I had is, if that's a new if that must not be a completely new program, because the difference between 26 and 27 is only $14,000.
Correct, yes. So we have been using an Ovalon. But
Okay.
we've moved another piece out of
Okay.
this line into the nursing department. So it's our
Okay.
staff education
Okay, thanks.
program. So we moved that out to
Okay,
streamline that a little more too. So
thank you.
yeah, but yes, we've been using an Ovalon
Yeah.
for
Okay.
for billing purposes.
The questions?
No, thank you for that clear explanation.
Uh-huh.
So if there's no questions there, those are kind of the key things that I wanted to highlight in that line there. So we can go over to the dietary department.
It looks like there's not any.
Yeah, just general kind of increases that we would see with supply costs and trying to
Yep.
reflect a higher census.
What we've
there.
been seeing.
I do want to just kind of highlight though the supplement line. You'll see a $5,000, almost $6,000 increase on supplements, and I think that's just kind of we are using a lot of supplements at the moment to help with residents and maintaining healthy weights. So our dietitian is working a lot with the dietary department, and so we just given the acuity that we have in the building,
Okay.
we continue to see that as a
Okay.
need. So I don't think there's going to be opportunities to make a lot of savings on that line. So that's why we're trying to reflect what our actual need is going to be there.
Yep.
Mhm. Makes sense. Nursing.
The nursing department. I think we, just to kind of highlight everybody's favorite subject of contract nursing, 5140-012.
That.
Yeah, so we're projecting a $50,000 decrease there. I think we're annualizing right now at 1.65 million. So I think that's where we're gonna,
Nice.
kind of balance out this year. We do have an LNA class in the mix right at the moment. So we're hoping, assuming everybody graduates and passes, we'll have 5 additional LNAs added to our roster. So we don't really have an anticipated need of contract LNAs other than maybe 1 or 2 for the upcoming fiscal year. Yeah, so it's really, and I don't know if Karen has mentioned or not, but I mean, we're gonna be at levels of the open FTEs that we haven't seen in years. So once these guys come into the mix, so
this is mostly
mostly nurses that we're gonna be seeing, yeah. So we still, kind of running into a little bit of trouble on the 3 to 11. And it's the 11 to 7 coverage is pretty good for us, but there's a little bit of a lag within the 3 to 11 piece that might sometimes dip into, over to like up until about 3 a.m. For nursing coverage. And so what we're anticipating is that a lot of money that is going to be spent out of this line in the upcoming fiscal year is going to be that based on nurses and not LNAs. So.
to both the LPN and the RNs.
Correct, yeah, and then we haven't, I think we have a per diem RN at the moment that is currently working at the Department of Corrections. She's been with us before, and she's just kind of picking up when we're in a really tight spot. She'll pick up a shift for us. But predominantly, the vast majority of that we would engage with through agency vendors are going to be LPNs. The other thing I just wanted to highlight on page 4 is 5140-170. You'll see a decrease of
Yeah.
about $10,000 there. Some of that is coming in the form of the LNA classes that we're doing. So White Mountains Community College has
Right, that's right.
lowered their cost per student charge to Grafton County. And we're also planning, instead of, we had been planning and budgeting for quarterly LNA classes. Right now we're planning, we've been doing 3 classes per year. Our current instructor, that's kind of what her schedule has been. We do want it to be shortly after the new year. We'll do one in the summer and maybe try to squeeze one in at the end of the calendar year. And so we're we're budgeting a cost of $4,600 per class. That would include 8 students in the class, and doing that 3 times a year. So that's where some of that money savings is, or decrease, sorry, is coming from that line there. So.
Any other questions?
No.
Thank you.
On page 5, I just wanted to highlight an increase that you'll see on line 5140-392. Specifically, what we're proposing to do this year is to have a supply of COVID tests available for staff. We specifically, and given the fact that we've had a somewhat lengthy issue with flu and the influenza in the building this year, affecting some residents and staff as well. We're proposing to purchase 3-in-1 COVID tests or influenza COVID tests. So it would be a test that would test for COVID as well as influenza A and B. When we were just solely focused on COVID, we had been using a lot of the supply that we had received from, whether it be the Department of Health and Human Services or at the federal level. We've just had those available. So like when we knew we were potentially heading into a wave of COVID, we would have them available for staff to take, so that they could keep a stockpile at home to test for their family or for themselves.
Yeah.
And we found that that was a really effective measure to try to head off the potential for somebody coming in and working while they were COVID positive. And so what we're proposing to do this year, as those tests are no longer, the expiration dates have been met on them, and so they're no longer technically safe to use, if you will. What we're planning to do this year is to try to help the staff out by buying these tests, because in my mind, it's a benefit for both the nursing home to hopefully head off the potential of somebody bringing in sickness, as well as for staff to be able to wear.
They're no longer provided by the federal government.
Correct. Yeah. And this is something that we would be doing on our own.
Yep.
And it saves the staff the money of having to, to spend on their own.
I was gonna say the 3-in-1, which are great, but they're expensive.
Yeah.
But as you said, it keeps them from coming in and
With
No,
Causing-
exactly, because, people wouldn't go to the, to the pharmacy or
Yeah,
Walmart or
you're
wherever to
absolutely-
buy them if they're, $20, $30.
But how much they are?
apiece. Well, they're often, I think this year, if you got 2 tests, they were somewhere between.
Yes, yeah, that's what it would be. It would be a box of 2 tests, and I think it was $28.
Yeah, I was gonna say it was a lot.
and the symptoms, maybe not for the flu, but the COVID symptoms seem like they're a little different. People seem like they don't know.
Mhm.
Like we always
Mhm.
felt like before we, okay, I know
Kinda
that's
do.
what it is.
Yeah,
Anyways,
yeah.
but
Yeah.
Feels like they're a little different.
Probably
And I
because
think
it's a
if you
limp
have
now.
them, people will
Hmm?
test,
It's a
whereas
limp now.
otherwise
Walking.
people just, oh, it's just a cold or
Yeah.
or whatnot and don't test. And the transmission is so different with COVID than it is with a lot of other respiratory viruses.
Yeah.
It's
Mhm.
good to know.
Mhm.
And that certainly played out from what our experiences have been, that when they've been available, staff have cleaned out the table within a matter of hours. And so it's been great to have them, have access to these tests and be able to test. them.
Absolutely.
So. The other change I just wanted to highlight on 5140-396, our glove supply, you'll see a $15,000 reduction there. So again, we're working through the supplies that we've accumulated throughout the course of the pandemic.
Yep. Mhm.
And so we do have still continue to maintain a healthy supply of gloves, and so we felt like we could reflect that better there. So while we are specifically focused with these are going to the monies that will be spent out of this line are really going to be focused on nitrile gloves, which we don't have a huge supply of. We still do, but so nitrile gloves for nursing and housekeeping as well.
Right, so we're restorative nursing. Have anything there?
I think just the 960 line.
Yes, yeah, the 960 line. So we are proposing this year, you'll see roughly an $8,000 increase on that line. The extra 1,000 based on what we're currently budgeted for is just to reflect any, additional shipping costs for part supplies that the restorative nursing department purchases for wheelchairs or, rehab needs. But specifically within that request for this year is $8,000 to create a Reiki program for our residents. So we do have the Reiki program in place for our staff. And when we've had cancellations or whatnot, our Reiki practitioner has gone out and met with some residents. And we found a lot of benefit to that, especially on our dementia neighborhood where she's been able to, help kind of calm an agitated resident through her Reiki. And so we've seen the benefit from that, as well as residents that have experienced, one of our residents in particular has experienced knee pain. And so the Reiki practitioner has been working with her as well when time has been available. And so we've seen that, from a calming standpoint as well as pain management standpoint, there's some benefit to having residents be seen through and participate in this program. So that's why we're requesting that to put a dedicated Reiki program in for residents.
Thank you. What's the cost of the staff Reiki and what's the participation?
We had $9,000 budgeted for staff Reiki, and she averages, I want to say 15 staff per week.
Okay.
So yeah.
Really used. I hear more and more from friends, my age group,
Uh-huh.
how important this is for pain management. It's really interesting.
Yeah, it really is.
People say it makes such a difference. I'm always surprised, but
Yeah.
it's some of the meditative work too that people use. Reduces some of the pain meds, the anxiety kinds of things, yeah.
So I realized last night when I was looking at this that we didn't have a department request for a total under there. So just to save you, yeah, okay, all right, sorry, thanks.
So
All right.
which means that the total at the end wasn't, the increase wasn't right either.
Yeah.
They have that all fixed.
I was gonna say, yeah, I don't see what we're missing, but okay.
There's really nothing to kind of highlight on the health information management page on page 7. So you don't have any questions?
Health insurance. Yeah. Out of our control.
We'll see. We'll see how the employees, folks go for the
Yeah, well, right.
suggested changes, maybe we'll see
Yeah,
something.
yeah.
Okay, how about there?
Same thing on, yeah, therapeutic recreation as well. There wasn't.
Nothing outstanding. And plant operation.
Plant operation, yeah, these figures are presented to us from Jim based on his
Yeah.
contracts that he enters into, and so divvying out the nursing homes portion of what the needs are, so.
Is there a reason for that's gone down a little, you think, around the maintenance allocation?
Yeah, I can't say, yeah,
Hmm.
yeah. Jim is very detailed, as we know, so whatever he has put there, I'm going with, so, yeah. The one thing I will highlight though here is on the minor equipment and repair line, 5150-810. You'll see an increase of $2,800 there. And what we're proposing to do is to install a new AV equipment, audiovisual equipment into the activities room. So specifically, when we have large group activities like bingo, for instance, we would like to have a better amplification system in there for residents to be able to hear. So we're proposing to put in 8 speakers as well as an amplifier and wireless mic system for the activity staff to use so that they can walk around. Right now, they have a stationary microphone that they have to, that's plugged into a box from, probably the 1980s that it's gotten a lot of good use out of, but we think that this is an opportunity to try to, upgrade and make an improvement to better the activities environment for residents. So that's what that increase is there.
And laundry, always interesting. Goes on in the laundry. Like anything, well, maybe the supplies are up.
One of the things that we're seeing there with that line is we did have some equipment that we didn't include in the capital budget this year that needed to be purchased. So it was an oversight on my part on that. So that would explain why the 6-month number is right at budget there. So and then yeah, just general supplies or cost increases there.
And I think we saw some of that in the Department of Corrections budget. They talked about their laundry supplies price increases.
Mm-hmm.
Housekeeping.
Housekeeping. I would like to talk for a minute on line 5170-002. We are proposing a half-year position beginning January 1st to replace our Assistant Environmental Services Director. So in 2027, the Environmental Services Department Director is planning to retire, as well as our kind of most senior laundry operator. And when those 2 people retire, one in September and the other in November of 2027, we're looking at losing 70 years worth of experience in that department. So what this position is going to do is to allow our assistant director to basically work hands-on with our soon-to-be retiring environmental services director, so that she can better understand the overall operation. She's very focused on the housekeeping side of things at the moment, so she's very involved with the ordering of supplies from that standpoint, as well as personnel management. So, but this is going to give her the opportunity to work shoulder to shoulder with the director to kind of understand the whole process when it comes to budgeting, to operating the laundry equipment and whatnot. So that's, we see some real benefit in implementing this position so that we can maintain the overall like, make sure the ship is continuing to go in the right direction within the Environmental Services Department. And so we would, ask that that position be included in this budget. It's probably going to take some time. Also, whether it's an actual January 1st start, probably not, but we would hope that at some point before the end of the upcoming fiscal year that we would have, we would have that position in place so that the assistant director would be able to work hands-on with the current director.
That's quite a staff too, to be overseeing.
Yes.
Yeah.
Didn't realize
Yeah.
that. Home services. Right, anything in the pharmacy? It looks like there's some big changes, but
Yeah, specifically on the veterans, what you see there, these are costs that we have to pay upfront, but we get it back on the back end through the reimbursement side. So that's what you see there. Because that's, it's based on what we're currently seeing on our VA caseload at the moment, so.
Here's our contract services.
Yes, yeah. I wanted to highlight our 5185-235, our contracted dietitian. That line, we had planned for, as you'll see there in this current fiscal year, we had an opening, and after, kind of things were working its way through with this budget approval for the current fiscal year, we did identify a dietitian that was interested in working with us. But her rate of pay was more than what we had anticipated for, and so that's resulting in some of the overage. But that money has been well spent. She has been a fantastic addition to our team. So we, what you see there in the department request reflects what her current rate is, as well as a planned request to increase that by $2 an hour. So she, like I said, she's been a truly committed to the team, and to, doing her job really well, which, unfortunately we had 2 previous contracts that didn't demonstrate that same commitment. And so we really want to try to, ensure she continues to stay with us. And, she, like I said, she's really doing a great job in helping to, work on, the weight management of residents, as well as, evaluating things from an educational standpoint for staff, auditing standpoint, as well as just looking at the dining experience of our residents as well. So she's really taking kind of a holistic approach versus just staring at a computer and, Craig's down 10 pounds over the last 2 weeks, so go fix it, She's really invested, and so we wanted to try to help recognize that commitment, as well as ensure she continues to stay with us, so.
That's
would
great.
explain
I
that.
found somebody, I know that can be hard to find a person to do that.
And, when we were really in a pinch and we were thinking we were gonna have to contract it to, or subcontract it through another company, the rates that we were looking at were $90 an hour, for
dear.
essentially all remote work.
Wow, wow.
So, yeah. So,
But the medical director, is that stable now?
it is at the moment, yes. Yeah, it is at the moment.
Social services.
Um, nothing of note there either.
Questions? So should we move on to the capital reserve?
Mhm.
Capital re-
There's a lot going on there.
Uh-huh.
Um, So I've spoken about the meal suite program, the POS system and the Inovalon managed care billing. Um, Those are all, like I said, just kind of blending in that conversation throughout the expense side of things. The next item is the installation of panic alarms. So we've had some instances, two in particular, this current year where we've had some people coming into the nursing home that we didn't want to be in there. And thankfully, we've had people, staff, be able to encourage them to leave. But, given that we're a 24/7 operation and our doors are open until 8 o'clock at night, if there aren't any staff around, because things don't always happen at 10 o'clock in the morning. So these panic alarms would be installed on the lower level of the building. We have panic alarms, like I have one in my office, the finance department has one, the director of nursing has one. And nursing units have them, but these additional 3 alarms would be installed on the lower level to allow for staff to be able to alert for assistance from the sheriff's department if needed.
And these are, when you say people that we don't necessarily want to be there, hate to ask for an example, but how often does this happen? Doesn't.
As I said, we've had 2 instances this year.
Okay, so
Yep,
I heard
yep.
that.
I would say on average over the course of a year, I would say it happens once a year. Where we have some people that come in that,
Family members?
no,
Oh. Okay,
yeah, members of the public.
wow.
And with the increase in just violence and shootings and people getting upset, we've seen an increase in healthcare facilities over the last few years, and I think our safety is paramount.
Absolutely. I was just thinking. that
No,
it
no,
was
I'm
family.
just,
No, I'm not.
Yeah.
I'm just, I thought that it was family. That adds a real new dimension to it.
Right on the street, right on the main road.
Yeah, right.
Yeah.
Exactly.
Place to be or to get in, from.
Oh,
Yeah, making calls or, we had one in particular that came in, and when I asked the individual to leave, they were trying to take stuff off our food carts that we were bringing to the floors.
I see.
So,
I see.
Yeah.
so it's situations like that,
Yep.
if I'm not there, or again, depending on the time of day, that staff would give them a little bit of extra security to know that there's, the potential to alert us, law enforcement assistance if needed, so.
So just another, that's really a shame. And so just another question. So when you say somebody that was trying to make telephone calls, or somebody who was trying to take food off the food carts, are these people that are in need? That wander in from?
Yeah, I can't say without knowing all the details of the situations of their backstories.
Yeah.
It's just that, their presentation is such that, and their response to, in this one particular case, being asked to leave was
Okay.
not what, we would want to have in the nursing home environment as family members are coming in and
Right.
whatnot, so.
Right. Thank you.
The next item, this was a request of Jim, for grout replacement for our, Granite Neighborhood shower room. So we have, grout that is, within the tiles that, on the floor there that is, continually kind of breaking away. that is resulting in leaks to the subfloor and then subsequently leaking down to the ceiling of our Meadow neighborhood shower room. So this is a request to have a contractor come in to do add new grout and basically fix the floor so that it seals it up and we don't have the leak issues any longer, so. The other item here, HVAC evaluation, again, this is a request of Jim's in regards to, I think he might have mentioned this, yeah, so this is the nursing home share of having this evaluation done to assess the kind of current equipment and what the needs might be going forward, so. The Hobart conveyor type dishwasher is a request to add to basically replace our 23-plus-year-old dishwasher that we currently have. That maintenance has done a very good job of kind of limping along, but it is time to replace it. And upon replacement of this item, all of our kitchen equipment is going to be up to date within, I'd say, the last 10 years. So that's kind of like the last major equipment replacement for that department, so. The Vitamix blender is just a high-speed blender that we would be using to mechanicalize resident food items or, other things within the dietary department. We were making shakes, for instance. The GlowRay high wattage infrared food warmer. So we did an experiment in this current fiscal year on our Granite neighborhood to address resident concerns about the temperature of food. We installed a kind of an infrared light over our steam table on the Granite neighborhood, and it's helped to maintain the temperature. So when residents are being served meals in their rooms,
Yeah.
it's coming to them hotter than it had been previously. And so it's been a great success. And so what this request is to add these same type of infrared food warmers to the Maple and Profile neighborhoods in their dining rooms as well. The Maxwell Thomas laminate tabletop. So that is an attempt to kind of help with dining room overcrowding, specifically on our Profile neighborhood. We have 20 residents on the floor that require assistance from staff to when it comes to dining. And these are a smaller tabletop that will fit to the bases that we currently have in the dining room. But what the theory is behind this request is that the smaller tabletops will allow for more space within the dining room because we have such a large number of residents that utilize wheelchairs like Broda chairs, for instance, that are very large and bulky. And when you have 20 residents in a dining room that need assistance, it creates a lot of space issues. And so this would be an attempt to try to help because they're not sitting at the table per se, they're close to it, but it's the staff that are using the table surface. And so a smaller table surface is really not going to impact anything in regards to the resident dining experience as much as creating additional space.
What are did you call them
Broda chairs, yes, yeah. So Commissioner Hedberg, you might be, but it's a large recliner on wheels, if you will.
Oh.
That's maybe a way to, yeah.
Oh,
So,
okay,
for a lack of a better way of describing it.
okay. Recliner on wheels. Okay, thank you.
The next item is a project that we would like to initiate is a renovation of our staff development office. We would In conducting this renovation, what we're planning to do is to create a simulation lab for the nursing department to use. So we would take the current staff development office and essentially turn it into a resident room. That can be used for training purposes for the nurses and the LNAs. And so what you see there within the cost is the, time and materials of the maintenance department, as well as, the installation of a new floor, in that area, in that office. But a lot of the other equipment, when it comes to bed or bedside tables, and anything else, we have on hand already. And so, that's really, it's the material that you see there in that cost. But what we end up doing, and especially like another benefit to this, is that when we have LNA classes and they sit for their state test, we have to bring a bed up from the basement into this space, so that they can demonstrate their clinical skills to the instructor from White Mountains Community College. And so, this will be another benefit to that, so that it can be used for training,
So this
for testing experience. But really, like when it comes to, because the next item that we're asking for is an advanced geriatric patient skills trainer. Essentially, it's a training dummy, if you will. And it's an advanced one from what we currently have. It allows for a nurse or an LNA to do full, essentially anything that they would care for an actual resident can be done with this training dummy. So if it came to like blood draws or,
Wow.
catheterizing, improper technique, so when it comes to skills, competencies, all that can be done in this space going forward, so that we're not, taking up the activities room, for instance, or our country cafe, which we would normally do when it comes to skills testing. All of that can be done in this space now.
So I'm still interested in the simulation lab. That's pretty interesting. So it simulates a room,
Correct.
a resident room.
Yep. And then with the training dummy, that would be in the bed.
Yeah.
And from a lift standpoint, the dummy has weight to it. So it would be like if we were doing a 2-person stand pivot transfer to the bed from a wheelchair, that can all be done with this dummy in this space.
And so currently, we do, outside of the patient skills, the outside of the dummy, the next item, outside of that, the dedicated nursing education simulation lab. So I heard you say that you might have to bring up a bed from the basement to me. Yeah. So where does that training currently occur? In the rooms that you mentioned, like the.
If there's an empty room,
activities?
it was a lot easier to do it when our census was in the 80s as it is compared to now when we have 124 residents. But if we have an empty room,
Okay.
we would do some training there. But a lot of it is done, just kind of reviewing paper and proper procedure, and having, the staff kind of talk about how they would do it and demonstrate it. It's demonstration that isn't truly reflective of what the actual skill would be in completing it. And so this would give us the opportunity to have that space to do so. And really assess the competency of the staff, especially when it comes to, with such a focus of infection prevention, from a regulatory standpoint, really demonstrating proper technique when it comes to, anything related to infection prevention and resident care would be, there's a lot of benefit to this idea, so.
And patient safety, because if you've read about how to, help a patient pivot, as you said, or roll them over, or on the times you have to move it back while someone can't get out of it. Reading it is really different than figuring out how to hold that person in appropriate body alignment. So, for our patient care and our education of our LNAs, since we're now training so many LNAs, it's really almost necessary instead of certainly a need and not just a want.
Sounds like a really great addition.
We're excited about it.
Yeah.
Yeah, we're excited about it.
This is kind of what you wrote it. It's just
Oh
a
my
really big
gosh.
padded wheelchair. That's just a picture that.
Thank
the
you.
First one. I pulled up.
Okay, thank you.
I don't know if you want. This is a big padded
Yeah.
wheelchair.
And what's the rationale? What, the producers of these, the providers of these have increased comfort?
That, and for people who are non-ambulatory, you need something like that. There's a lot of people who can't walk.
No, I know that, but I mean, I'm sorry. So
Positioning.
outside of a regular wheelchair.
It's positioning and is the big thing, because,
Okay.
some people might, some individuals might not have the ability to have trunk control to sit in a standard wheelchair. And so
Got it.
As they don't have that, they need additional like pillow supports or
Wow,
winch
okay,
supports.
thank
And
you.
that's, the larger chair allows an occupational therapist to, get them seated in a comfortable position, using winch supports to help maintain their
Yeah, okay.
proper body
Thank you.
alignment and
Because especially
positioning.
at
So
mealtime when you're
Yes.
trying to feed
Sure.
somebody and you need to. keep
And
their
if you
head
think of
controlled
someone
and
who's
stuff.
had a stroke who may, in a
Yeah,
regular wheelchair would,
Sure.
you couldn't get them into proper body alignment.
sure. Thank you.
And then we have our.
Resident, a yearly request on resident mattresses. Yeah, it's just continuation of replacing outdated mattresses past their useful life. The computer replacement is identified by Scott. I think he identified trying to remember here, 18 desktops and 1 laptop that was past useful life. So we were looking to replace those. Handheld documentation for LNAs. What we're in the process of trialing right now is and it's proving like it's going to work, I believe anyway. Currently, our nursing assistants will provide care to a resident, and at certain kind of hours throughout the course of a day, they'll sit down, we'll say 10:30. They'll sit down at a computer and go through their documentation to say that, they assisted Craig with breakfast and Craig ate, 50 to 75%.
Mhm.
And, any other, care related things that they did for me. What this would do is basically what we're proposing is to purchase an older model iPhone, an iPhone 15, that will run our point of care entry program that we use through Point Click Care. That's our electronic health record. And so
Oh.
the LNAs document in a point of care module. This module is a free app on the iStore that works for right at the moment is demonstrating that it works well on the iPhone. And so, they're able to carry that with them. And they're able to do their documentation right from the right there in the moment, essentially, or if they're assisting a resident on the toilet and they're waiting for the resident to finish, they can be standing outside the room, or if they're giving a shower and they're allowing the resident time to, kind of soak in the tub or dry off, and they're outside of the shower room, they're able to document other things that they've done during that time while they're waiting. So there's some improved in productivity, but also the big thing is more accurate coding and timelier coding as well. And so that can only go to help us capture,
Right.
what it is that we're doing from a care standpoint for residents. Improving accuracy there has the benefit of potentially adding to the overall picture of acuity that we have for residents as well. So. And way back when, we did have a handheld documentation option with our previous medical record. We used to use Palm Pilots way back when. And so when those went by the way of the dinosaur, we didn't have another, kind of option until this materialized. So,
So this type of system has been used before.
it has.
Yeah.
Yep.
Okay.
Yep. The next item is activities courtyard furniture. So these are furnishings for the outdoor space in our activities courtyard that we weren't able to include in the request that or the grant essentially that we received from the federal government. It didn't include furnishings, and so to have weather resistant benches and chairs and tables underneath the soon to be forthcoming pavilion structure. These are, that's what this money would be used for. Resident recliners for common areas. We have kind of a hodgepodge of recliners that are appropriate in some instances for some residents, but not for all. And so we would be looking to kind of create uniformity for recliners on our resident units in the common areas. So when they sit out in the common areas for socialization or to watch TV, whatever it might be, we would be able to have kind of like I said, more appropriate recliner options for our residents.
Chairs they can get out of.
Yes, exactly. Yeah.
Yep.
And the last item, the Aztec Guzzler Solution Retrieval Machine is a piece of housekeeping equipment that it's a scrubbing and stripping machine that would help in maintaining floor overall condition of the floors in the nursing homes.
And I think that's one that Jim had talked to us about, and this is your portion of it. Or is this
So
separate?
no,
just
I
for
don't think
ours?
so. I think this is just for the nursing.
Okay.
Yep, yep.
Those were vacuum.
He was talking one about
Yeah.
yeah,
For the house, for the custodian.
custodians.
So just remind us for our purpose, the nursing home capital reserve. Where that comes from and what's
How
still
it's funded.
there, how it's funded, yeah.
So, historically, it was funded in the years when we received the exceptionally large pro share payments. We took a portion of the pro share money and put it into this nursing home capital reserve account. There has not been a contribution for at least the last 2 or 3 years. And so the balance,
Yes.
which I just barely got done doing, if we were to spend everything that's been obligated at this point in time, is the balance is $254,402.02.
Oh,
Could you repeat that, please?
$254,402.02.
And that is after this.
So that is
Before.
before this.
Before, I
Obligated, yeah.
see, okay, so. Even,
and we don't have we haven't funded it in 3 years, and are we going to be able to build if we were to spend 240,000 out of that? I'm not saying that we are, but if we did.
I'm not, and I don't believe Craig's anticipating that we're gonna get any windfall pro share payment this year, so. I mean, if you're gonna make a contribution to the capital reserve account. It becomes an expense, so.
Right.
we just need to make sure all the things we're doing here have a lifespan
Oh,
for some.
that leaves us with $14,000.
I mean, and that's, like I said, that's. Craig's still got a number of open projects, and some of them won't come in at the total expense that they're budgeted for. Only speaking, most of them come in a little lower, so. But that does include the nurse call system.
Yeah. And what we've budgeted for that, it's, I would imagine, just conservatively speaking, probably $15,000 below what we budgeted. So there'll be money
Some
that
savings over what's been obligated that will accumulate as well. I just went through and did a cumulative list of what's been approved and what's been
Okay,
spent thus
thank
far
you.
and where we're at. So this is, if you will, worst case scenario, if every dollar was spent that has been approved thus far.
Okay, thank you.
Not saying that there'll be a significant, not underspending of that, but there could be.
Okay,
We have a definition of capital, and I'm just thinking, in terms of either longevity of how long something lasts or the,
We absolutely
Dollar.
have definitions for capital. The nursing home is a little bit less, the dollar amount is lower to capitalize than it is for the general county, but yes, we do have
okay,
definitions of lifespan and cost.
okay.
That's our fiscal 27 budget request.
thank you.
So the last page is just a redo of, yeah, that summary of this, okay. Great, other questions for Greg William?
I asked for money.
Thank you for the
Thank
thorough
you.
presentation
Uh-huh.
and taking
Thank
time out of
you.
this stressful week.
Sneak away.
Yeah, thank you.
Thank you very much.
Take a quick break since we don't have Scott here. So usually,
You for hours.
yeah, usually we don't worry, unless there's a change in the number of, asking for
Yeah,
a new
yeah, yeah.
position or there's a retirement or whatever. We don't worry too much about the top, line items because there's not a lot we can do about that. It's more of an overall, decision around things or the health insurance costs and so on. So we usually go down to like 170 and start there. And then, talk about any
Anything, yeah.
significant
Yeah,
changes that you're anticipating. And then your sort of narrative around that justification. So, and it looks like we could do that. We can do that with this one. So if you want to start at 170, obviously this was not included previously, so you're adding education or conference there.
Yes. I'd like to, as the IT director, actually as any IT person, attend trainings. Usually they're centered around cybersecurity.
the magic word.
Yeah, right.
Why that line item is there. I also know that we, as county are doing the
Yes, right, we're hosting it.
hosting this year, and from what I understand, they're going to go over what happened the other county this year.
Mm,
And
Yeah.
I think it'll be very useful and interesting to find out. Not necessarily, I'm sure they won't tell us exactly what happened, but
Yeah, what county
What-
was
Is it
that?
Rockingham?
Hillsborough.
Hillsborough.
and what how their response was, and that will also help us because we are right in the middle of
Hmm.
finishing up our cybersecurity policy as well, so.
They're still recovering from it, so.
Wow.
Yeah.
Wow.
Takes a while.
There's also been some municipality this week. Was that in your note? I'm trying to remember where I read about that.
I was trying to think of the same thing. I saw a headline and I don't
Yeah.
remember where it was.
So, yeah, that doesn't ring a bell. If we go down to contracted services, there's, actually, this is a little bit lower
Yeah,
than the year before.
Yeah.
Julie could probably talk better to that than I can at this point, because she's the,
Well, I think it was you adding you, right? Who's helping this go down or not? I don't know if that was not a significant.
It's not, without going and pulling out all the numbers, it's
Mm.
just, that's what the contract is for this
Mhm.
year, so.
970. Line 970
Mhm. Yep,
is a
increase.
$17,000 increase.
and so, yes,
For new equipment.
new equipment, yes. I will talk very much about that. Over the years, from what I understand, we unfortunately have not, as a county, kept up to date with our computer computers. This is not the best process, but it's okay. One of the biggest problems that we had, with last year's, numbers is that Windows 10 became end of life. So then in turn, we had to upgrade to Windows 11. So on this, you are actually looking at, in this number, you are actually looking at 16 PCs that we could not upgrade because they were too old. So they have to be done this year. That is a security issue, and they will no longer patch. So I shouldn't say this year, I should say in our next fiscal year. In addition to that, my total recommendation would be to go to a 3-year cycle of replacing computers. That is the standard.
As opposed to which is it now?
I'm sorry.
Which is it now? What is the cycle
It
now?
wasn't.
We
There-
have,
there is
we
no
didn't
cycle.
have one yet. We have computers that are
Oh.
more than 5 years old right
If I can I just step in for one second?
now. You may.
Prior to 2021, we did have a replacement schedule.
So-
It was a 5-year replacement
Yeah,
schedule.
okay, I thought so.
When the internal IT department went away and we
Oh.
went to a managed service provider, that's been something Holly and I have fought with them
Yes.
for the last 3 years about, and it just didn't exist. So
Thank you.
now that Scott is here,
Here,
we've talked a lot about a computer replacement schedule.
okay,
So these numbers actually indicate the 16 Windows 10 that need to be replaced, as well as getting us into a 4-year replacement cycle, which I'm comfortable with.
You wanted 3, we had 5, we agreed to 4.
Oh, I see, I see. And it sounds
With
like the 16,
compromise.
it sounds like from what you're saying, Scott, it sounds like the 16 PCs is not negotiable.
It is not, they need to be done, yeah. They need to be done.
And these
That's
are
software maintenance.
administrative.
They are.
as opposed-
countywide.
We were just talking about the,
Yes, the nursing home. has their
Nursing
own separate.
home.
Right.
that's
Nursing
separate.
home is separate, and I gave them their numbers as well,
Okay.
so they are aware of my plan.
Reasonable. And then 984, the software maintenance and renewal. That went up quite a bit.
Yes, it did. Some of that, of course, is departmental. The attorney's department actually
Oh,
quite a bit.
Good.
County
county
attorneys.
attorney.
Yeah,
Oh,
I think essentially all of our software contracts usually have an
they have,
inflationary increase in them every year.
okay,
And this includes basically every piece of software that's used throughout every different department in the campus. It includes the UKG software we use, the Infinite Vision software we use. It includes the CSI software the sheriff department uses. It includes the
okay,
Propel that the county
wow.
attorney's office uses. It includes the jail management system at the jail. It's all inclusive of everything. And
okay, thank you.
plus it includes all of our Microsoft licenses, which every 5 minutes.
yes.
Yeah.
Now, there's a lot in there.
Mhm.
You look through the detail pages, you can see it's broken out by department and it's broken out by,
Okay, okay,
probably somewhat more confusing, but all the detail is
Okay.
there. I'll stop talking, let Scott.
I feel like we did that last year. All right. Other questions on this?
no, thank you.
Great. So then we move to the capital outlay. And there is nothing on it.
Nothing.
Okay. All right. Do we need to look at this by department?
It's all totaled and summarized
Okay.
on this face sheet. The breakdown that you have to find it is just what goes into all of those numbers, but the working sheet that
Okay, thank
gave
you,
Scott to use to develop the budget. So.
Okay.
thank you.
Okay. Other questions for Scott? We have him here.
No, but I feel like he's probably prepared for many more
I know, I
questions. And so we should
I would
check
check
for you.
not to ask questions.
Maybe, has it been any significant issues, recently
Good job.
with the IT?
Things are going well. Thank you.
I like the idea that you do the Friday newsletter. And
Yeah,
keep
it's nice.
reminding
Thank you.
people about what, what you're there for, information, gives them little tidbits and just, yeah. It's good.
Are you gonna send out something about the email we got yesterday from parents?
Probably not. And
Okay.
Yeah.
I,
explain it to you, read through that, you will understand why I wouldn't. And I can explain that to you.
you'll have to, because I did read through it and I don't know. But you'll have to do it.
Too many variables involved. Let me just put it that way. It would cause more confusion than help, I think.
Okay.
Are you finding, that the staff at the county are careful about, situations and fishing and all sorts of things that come up? Are you finding? is there any
From what I can
issues?
tell from getting information from Thrive, we are doing okay. As part of this budget, I have put in monies to have a company do monthly,
Training?
well, not ratings, specifically,
Tricky one.
monthly.
Oh, yes,
checking.
I get those all the time on my work.
Yes, and once we start seeing those come through, I will have a much better picture, because we don't have anything that does it automatically right now, that tries to
once a
make
year.
people think about it. And just the software will, it will.
We do get them a lot, and then it usually sparks a training, going back and having to go through a training module. Yeah.
Absolutely, yeah, and that's my hope as well.
Yeah, that's great. It's a really good program. I think it cuts down on the things that could happen. Folks do. Really, I think people become much more aware, even in their personal life.
Mhm.
It's-
Well, and absolutely, I mean.
Yeah.
Yes, it's important when you're in a corporate world, but let's face it, we're all.
Yeah.
On it personally as well. I mean, all of our banking is done online most, for the most part. So it's, yeah, it's important.
Interesting too. I don't mean to delay or whatever, but it was something I saw, maybe, I don't know, it was one of the New York Times type things, but story about, I think it was in Burma, was it Burmese? Myanmar, where they had built a huge building. And I think it was a Chinese cartel who had
Oh, for the
Come-
data mining, to the scams,
the
yeah.
scams, and they,
Oh.
and so basically the traffic, it's also trafficking people, so a lot of people were being
Yeah.
forced to work there. But huge office building that was just going after people and
Wow.
to scam them.
Isn't that something?
And they had to get, in order to not get, say, hurt in some way or not fed or whatever the, ways that they were controlling people, they had to have so many a day that they had to scam, and it was, did you read that story too?
Yeah, and I had heard a long story about on NPR, and it was someone who had went to one of those countries, and thought it was a job. And then they realized that
Oh,
they
gotcha.
couldn't leave, and it was.
I heard about
It was this
something
long
like that.
expose on how they
Imagine.
actually got out, but that same kind of human trafficking and the various scams they ran out of these huge
Yeah.
centers, whether it's financial, dating, the ones that call and say
Yeah,
your
yeah.
grandchild, that it was arrested and you need to save
Yeah.
them, so.
There was actually one just recently that was a Canadian situation, people in a building in Canada where they were doing something like this. I
Yeah.
thought, that's a whole lot more expensive to upkeep that that office building, but
Yeah, and I just did a quick check and I didn't see a headline on what the cybersecurity issue was
Oh.
that I had just seen,
Yeah.
so I don't know what it was.
I don't either. Can't
So.
remember. Well, we really appreciate having you on board and
Yes.
the work that you're doing.
And thank you for your presentation.
Yeah.
Thank you.
See, but you understand that now we deliberate over it, so we
Yeah.
get, this is information gathering, and then we will go through
Right, then we go and
everything.
look, yeah, definitely.
We can be very nice when we're just listening.
We all have a job to do. That's what I'm saying. Remember, we all have a job to do.
Right, right. All right, thank you.
very much.
Thank you.
Y'all have a great day.
You too.
You too.
All right,
We're
other,
gonna turn to tab 10. I'll just jump ahead of email. It's not here yet, and it's not 10:30, 11 o'clock. So I'm on the agenda today to do the human service, the county cap, part of the budget. So you'll see that this budget's down. So, happy day.
Huh.
I think I gave you all.
wait, how's that possible? I thought it went up.
So I've given you all
So.
how we literally guesstimate what our county cap is gonna be. So what's important the first thing that's important to know is that, so we have a budget of 7,812,000 for the county cap for fiscal year 26. But our actual county cap is only 7,367,000.
Okay.
Yes.
Okay.
So the county cap is set statutorily by the legislature each biennium when the budget's set. And last year, as you well remember, statute says 2%, but the cap is going up 3% each year. So the cap itself is going up for fiscal year 2027. Then how that cap is dispersed is it's dispersed on the percentage basis based on the 3 years. So every full net claims are put into a spreadsheet, and percentage of whatever those claims represent for each individual county is the percentage that that particular county ends up paying towards paying of the county cap. So interestingly and strangely, if you will, our county cap percentage has been going down every year. So, for example, with the 2026 cap, so it's based off of the 3 years prior to that. So in 2023, our percentage was 6.125. 24, our percentage was 5.888. And in 2025 was 5.518. So while Grafton County is aging, so is the rest of the state. And those other counties are picking up larger,
Son of a gun.
are aging faster than we are. So that it creates our percentage. So what we did when we did this year's projections is we took, so the actual gross county cap is $139,879,303. So so the 6.125 is gonna drop off of our high year, and we'll pick up our actuals for 2026. But I know that 5.888 and 5.518 are gonna be two of the three numbers that are used in there. So I said, well, what if it, is a worst case scenario down to 6.25%? That averages out over the 3 years to 5.9%. So the column in the blue is what we ended up using. So we used a 5.9% percentage for Grafton County for next year.
So that number, that 5.9% is of the 139.
Correct.
Okay.
And it comes out to that $8,252,878.88. Then, as you all, I assume, know, we have this $5 million statutory credit that's part of every single year, so the gross cat gets reduced by the $5 million credit. That's dispersed in this way, but based on different numbers and different percentages, so, our percentage last year for that was 4.287. Percentage for that has also been going down, so, which makes sense, I guess, if we're picking up less of the responsibility, if you will. And then last year we had Chuck's bill, affectionately referred to, where
Oh, yeah.
the $5,625,000 credit for 4 years was put into place by the legislature. That percentage doesn't vary, it's straight across the board, 6.308% for Grafton County for the 4 years, so that's a known number to us. So those two credits are then deducted out to bring us to the $7,659,099 credit, or cap that we've used in this particular budget. So it's $153,000 decrease over last year's budgeted county cap, but it still accounts for an increase in what our actual county cap from this year is, if that makes sense.
So when is that number actually verified by?
September.
In September, okay. Yeah, that's helpful.
Helpful, yeah, it's super helpful. So we do our best to guesstimate what that number will end up being, and sometimes it's high and sometimes it's low, and
Yeah.
we work with the information that we're given and try to do our best to calculate, what it will look like for fiscal year 20, the coming fiscal year, but that's what we did, and
Okay.
that's how we arrived at the number that
Thank you,
in the proposed budget for you.
And it is very confusing.
It's
Mhm.
extremely confusing, and I've been talking about it for 30 years, and it's so confusing
Hasn't done any good.
to me. I feel like I know a lot more than I did, but
Yeah.
it's still confusing. So that's
That's
that, yeah.
Fascinating. I'm glad I walked in on this conversation.
Yeah. See? What would have happened if you hadn't?
You should have come around for the nursing home budget.
Oh, gosh.
That was fun.
Well, at least you all are well versed in budgets now that I'm here to present mine.
There we go.
Hi there. I'm not floridly presently sick. I've got postnasal drip from a cold from a couple weeks ago, possibly some allergies. I might be allergic to budgets. I don't know. So, nice to see you all. Thank you. Allison was kind enough to get me water. And I have a voice, so I'm good. Shall I get started?
Yeah.
Get started? Okay, so I think I should just preface this by saying, I imagine you all are just struggling with all the different personnel costs that are coming before you. And basically, that's what our budget reflects also. There are no big asks in here. It's basically a human budget. I mean, we're not looking for a new vehicle. We're not looking for any of that, but
Yeah.
I'll go through it, but you'll just see that that's basically what it boils down to. We've also applied for a couple of grants, which we've not heard back about yet, but those offset some of our costs. And again, we'll just go through it. So
We have in front of us, we have the VAWA, VOCA, and the circuit.
Revenue.
court
Revenue.
revenue, love it. The other revenue that's not included there, which is pretty minimal, but it's, I'll be talking to Keith Johnson next week. I came to you to talk about a particular small town that was looking for some prosecutorial help. I talked to Julie about it. It's misdemeanor assistance that he was looking for because he just doesn't have that kind of experience and he doesn't have the money to buy into a regional town prosecutor. So we've been charging him, or the agreement was that we would be charging $250 a case. I believe that's what it is. I'm sorry, I don't have the contract in front of me. And the reason I don't have it fresh in my head is I haven't completed a case for him yet during this last fiscal year. There is a case that should be being resolved next week. And so I'll have a sense of, we will send him a bill. Julie and I will talk and he'll get some sort of a bill, but that's the only other type of income that we'll have. So For the VAWA grant, yes, on 4008, we have applied for the $30,000. We've applied for the VOCA grant. There's a greater request that we've been able to ask for this year under the VOCA grant. And so I think that what we submitted than what we've done in the past. So I think what we've submitted should justify them giving us that, but you know, the pool is great that are requesting the monies from the government. So our needs are also great. Hopefully we've convinced them that we are entitled that.
So the VAWA is Violence Against Women
Violence Against Women Act and the
is the
Victims
victims.
of Crime Act. So those are both federal grants that are maintained or managed by the Department of Justice AG's office. The circuit court prosecution line is a wash for one of our assistant county's attorney, Mariana Pastori, is hired, works out of the Hanover Police Department. And so the request that we're looking for this year includes again, the personnel costs increased, but otherwise they pay fully for her services. What it maintains her under our umbrella, as an assistant county attorney, and it allows them, I guess, some confidence that if there's a need for coverage, one of us will cover it. And so I've been down there this past year to cover cases, conflict cases and the like, but there haven't been quite as much of that this year as there has been in the past. But that's part of the agreement and the reason for the.
Gives them some security that.
Exactly,
Yeah.
yes. And then she, you know, like other prosecutors, she often contacts us when she has a case to sort of talk about elements and ability to prove. There's a lot of interesting things that happen out of the Lebanon, Hanover area, not just because of the school, but also because of the large population. Commissioner Piper, do you have a question?
Nope,
Oh, okay, sorry. I'm looking at something.
that is my district, but I don't have,
You're
yeah, thank you.
welcome. It's an interesting port. It's nonstop on certain days of the week down there in Lebanon.
Yeah.
So now we're into the expenses,
Okay.
and usually what we do, unless you're asking for an additional position or there's something happening
Yeah.
differently, we can
Yeah,
generally go down and
see
start.
anything there.
Yeah, with 170.
Can we
And
just
even
start
there, I
with
don't.
Can we start with 03?
Oh, okay, got something there?
I would, yes, thanks.
Yeah.
Oh.
Oh, yes, that's right.
So we hired an investigator, Diane, I think 3 years ago now. And so we were able to use ARPA funds for a good portion of that time of hire. But obviously this has run out. Julie's going
It's
to
over.
chime in. And so we were at, I want to say we were at 50% last year. And so now we're at full bore. 50% paid for by ARPA funds last
Now
year.
it's zeroed out.
Yes. So that's a jump.
Okey doke.
And that's for investigative services.
Yes, which is really it's not a new position. When I came on board, we were sharing an investigator's position with the sheriff's department. Wayne Fortier was paid for primarily by the sheriff's department, but he was assisting our office in a lot of cases, both cold cases and current ongoing cases. And so we worked to fill that spot after his passing.
Oh,
Yes, he died of COVID, yes.
okay.
Is there,
Questions?
oh, sorry. Is there an opportunity to share that expense again? The investigative, it was shared with the sheriff's office with Wayne, and I'm just wondering with Diane if there's an opportunity to.
Well, the issue is with Diane, she's not a sworn officer, and there are county's attorney's offices across the state who, like we do not have a sworn officer. We haven't found that it's necessary to send her out to arrest people or to submit search warrants and the like. So I mean, I've not spoken with the sheriff about it, but you know, all of her officers all of the sheriff's department
Okay.
sworn.
So, and that's the difference between her and Wayne.
Yes.
So this question's for Julie, probably. So is this the position that I know we were concerned way back when about ARPA funding for personnel costs. Is this a position that we talked about, that it would be expired and that the person that would be hired would be told that the funding might not continue?
No,
Okay,
this position from the time it was funded with ARPA was told that it was going to be a permanent position, and that once ARPA funding was done, the county would absorb. That's why I think the first year we funded it 75-25 out of ARPA, and then we did 50-50, and then we were gonna go 50-75, but we had plenty of ARPA money left, so we left it at the 50-50 just to ease the burden but we've always talked about the investigator position being a position that the county picked up after ARPA funding was.
thanks. Because, and it's been a position when Wayne Fortier was here.
He was full-time for
Yeah.
the county attorney's office.
Yeah.
Okay,
thanks.
And I think it was, after Doug, Sheriff,
Futile.
no, after Sheriff Dutal, excuse me.
Mhm.
Yes, I think it was Sheriff Stiegler who, had him on and allowed him to be shared by us, but I don't remember the portion that we paid for his services,
Okay.
for his work. Excuse me,
All right, any other surprises like that?
that was the big one.
Okay. All right.
I don't see anything.
Oh, no, even all the way down here.
On the next page. What's with all the reductions? Thank you, Marcy.
Well, we're trying to be careful, obviously, and we're trying to make sure that they're put in the appropriate places. So Allison has been working really hard to, again, manage those costs and shop around. One of the things that we are including in our litigation expense line is a transcription service. We have found that just based on the motions that we receive and the litigation that we are undertaking, what we were doing to transcribe had a huge human cost. And the other programs that we use were not as effective or efficient as this justice text. So that will make us a little bit more efficient, and the expense isn't that great overall, just with respect to everything else that we have going on. But otherwise, as I say, Allison has really been watching the pennies and trying to keep us in line.
Can you talk about the 970 new equipment?
970.
Yeah, I'm sorry.
That was because of the copier that we have is about to die. And so we've talked to Julie about what happens over here. And so you will do a lease scenario that we're going to try to get into.
Okay.
Seems to save money kind of overall, and it's a
Okay.
little bit greater protection. So that's where that comes in.
Thanks.
Okay. Other questions on this expense before we go to VAWA?
So
Anything?
yeah, basically personnel costs overall. And then, as I say, we're trying to get the money to offset a good portion of this, if not all of it,
We're getting 30,000 for this.
if not a minor portion of it.
All right, and then the other one.
But that was a good
Thank you.
attempt at telling us it was gonna get paid.
I jumped in, I went ahead. That's right. Good catch. Thank you.
Can I just start out with the victim witness one?
Please.
So on the victim witness, you see two different budgets, there's 4112 and a 4113. Like alternative sentencing, they're broken out for grant purposes. So the 4112, so this is the two budgets combined is the cost of the victim witness program.
Okay.
The 4112 is the portion that we anticipate we will not receive any grant funding for. 4113, if you look, is the same as the revenue. It's what we anticipate, it's what we submitted as a grant application for, and it's hoped to expect to receive an Avoca grant. We're supposed to know by April 9th, so we'll know by the time you start deliberations if we need to make adjustments to those numbers, but that's why they're broken out into two separate budgets. It's because of the grant funding that we do receive for the Avoca services.
And so the VAWA, that is grant funded.
We get $30,000.
I thought you said that's it?
Mhm.
And so it costs the county 130,000.
That's 30,000. I think we've had that Bow grant as long as I've worked here, and it's always been $30,000.
Okay, thanks.
Yeah.
Okay.
4111.
Obviously, used to be a lot closer to closing the gap
Exactly.
years ago, but. here we are.
Exactly.
All right, well then, given that this is probably a little hard for us to figure out, is there anything in here we should know?
Well, I actually have a question on the county funded portion. It looks like
Yes.
salaries went down by 50,000.
Because I'll take
Please,
that.
thank you,
Yeah.
Jewel.
Because, so last year, current year, our VOCA funding is VOCA funding is $159,000. By being able, they changed the process this year and made it a competitive grant process and allowed us to apply for up to $300,000. So what we did was currently, we fund 50% of one of the victim witness coordinators and 100% of the circuit court victim witness assistant out of the grant. What we're advocating this year to do is fund 70% of one of them and 50% of another one and the 100% of the, so we're requesting more funding
Okay,
to cover salaries, which is why the non-grant funded portion went down. You'll see it went conversely went up
Yes.
in the other one.
So can I just be picky for a second? So just going back to the VAWA grant, and thanks Julie for that reminder, that it's always been $30,000 ever since Julie can remember, which is a long time. But that was closer to the expense back then. And so now it's nowhere near the expense. And so I'm just wondering, was this a federal initiative to begin with?
Yes,
The VAWA was a federal, and so they expected that it was 30,000, they expected that that would pay for most of what was needed back then, and they've never increased it.
Right.
Just asking.
yeah, no, I mean,
But at the
that.
same time, you would have to prosecute those cases regardless
Right.
of any federal initiative. So the fact that we get 30 to offset it is at least something, because we'd have to prosecute the cases. This is broken out for the same reason as the other one, because a number of years ago, the AG's office made us start doing things a lot more clearer, like
Okay.
from expense and revenue purposes. This used to be one of the assistant county attorneys inside the county attorney's budget. But then we had to break it out. She has
Okay,
a specific attorney that does prosecute these cases, but it
okay,
used to be part of the county attorney's budget just with a $30,000 revenue offset. So we would
okay.
have the expense regardless. But at least we get a minimal amount to help offset it.
So this is violence
Is
against
it mostly,
women.
mostly domestic violence cases?
Yes.
Yeah,
I
sexual
see.
assault.
sexual assault, yeah.
And so it's I think what I was thinking of was the victim witness program that's non-grant funded. That's just simply not, that was never a federal initiative. The victim witness,
that's the other half of it. Either the same, this is county funded as that, and this is the grant funded portion of it. Of
yeah,
victims of crime,
okay. Thanks.
I believe.
I was just gonna add, and Julie would know the number better, but we used to get a lot less money towards our victim witness program, and thankfully the Attorney General's office was able to increase it
Okay,
several years ago, but and they did a big jump then, and now they've changed their procedure and they've given us a bigger opportunity again on this particular.
thank you, okay.
So that's probably federal money too that comes to them.
Yes.
Yeah.
Yes, and we last year we were wondering whether that number was gonna be reduced.
Yeah.
We've been lucky that they've given us an opportunity to ask for more, request more.
And there aren't any changes. It's just the structure of what's grant funded versus what's not grant funded. That are the differences in the budget numbers that you see. There's no difference in personnel or anything like that.
And so you can move things, you move things into the grant funded.
We requested to, we submitted our application on March 19th and paperwork says that by April 9th, they'll be doing award notifications, so.
You
fingers
asked-
crossed.
You asked, we moved things into the grant fund.
Well, they're just a different
Yeah.
line item, so I'm assuming that
Right.
whatever can go into this would go into it.
We did as much as we could.
So just another question then on that, because I think I'm understanding, I understand the breakout thing, but if part of it was, it's federal funding, and page 5 is the federal funding, if 4112 was not ever grant funded, how did those positions come about?
Okay, definitely.
I think you're,
Yeah, I'm doing something wrong.
well, I think it's not clear, so 4112 has always existed. We've
Okay,
always had a victim witness program, and when I say always, I don't know how long, but when I came, we had a victim witness program.
okay,
We used to receive a similar like $30,000 allotment or 35,000 for the victim witness program. Throughout the years, the AG's office has done a good job at getting more funding for
Got
this.
it.
For us, for the people that provide that service and getting it out to us, so, the whole victim witness program used to be included in the 4112 budget. But then when the AG's office a few years ago made us break everything out so they can see everything clearly just by picking up a piece of paper, we broke them out into the two
okay,
different.
thank you very, very much.
And
I
we
got it.
have regular meetings with them about different aspects of it, so, yeah. Yeah.
We've got medical referee. That has not changed.
No,
Any attorney capital outlay, there's nothing there. Okay. Oh, and that's easy. That's the last page.
that's about it.
Read the easiest one.
Look at that.
So far.
Not quite, but.
The exception of the grant.
But well done, well done. Thank you.
You're welcome.
Thank you.
All right, well, anything else?
Oh, I was gonna ask you the same thing. Is there anything else you want to tell us about? Confess to?
I will confess to something that I confessed to some people the other day. I listened to a Karen Carpenter song, beginning to end,
That's
the
good.
other day.
That's a good thing. Which one
Is
was
that
it?
therapy?
It was, it
Would be.
was a challenge. It was a challenge.
No, no.
Yeah.
No.
Ticket to Ride was their interpretation of Ticket to Ride.
Oh, I'm not sure about
Oh.
that.
There you go. Beginning to end. I listened to the whole thing.
Okay.
Like 2 confessions.
Beautiful voice, though.
She does. She did. She did.
Maybe you could have chosen another song and it wouldn't have been so hard.
Yeah, why?
Well, it came on and I thought, I'm just gonna listen to this and see.
I don't think Carpenters would do Ticket to Ride.
We did. We tried. Take.
No, I'm saying I don't think that would go.
We'll regroup on that another time.
Yeah, I'm gonna look it up. I'm gonna listen to it.
Good confession.
Okay. Have a good day, y'all. Thank you very much.
Thank you.
We'll see you.
Okay.
Now you're up to social services.
Oh,
Is it just the one page though? There's not.
One thing.
This.
And I brought my stack back because I lost some notes.
Oh, me too. Me too. It made a lot.
Get my stack.
I'm curious if we came up with the same opioid potentials.
yeah.
Put these little red things all over there.
And I wrote mine on it, but I did in last year's budget, where it was, because we didn't have this page, I went to the last year's budget and put a bunch of notes.
I also separated them by districts, just for the heck of it.
Oh, I did not do that.
Oh, you should, it's pretty significant. Plymouth area, and that's the Lebanon area, and then there's. I just found it interesting. There was not a lot in Northern Grafton County, other than the core. Court services.
We fund the rest of them through opioid.
I was
I
gonna say,
was sort of justifying. the
I was
fact
gonna
that we
say
just did
that the opioid abatement, we've done a lot in northern.
But does that indicate that we have more of that in Northern Grafton County? Wondering.
I
we have
think that the
fewer-
word just got out fast in northern Grafton County, that each, you know, and I don't think it's bad. I think that people talk to each other within their regions perhaps, and it's, and I'm not saying it's a bad thing, but I think that it looks like one, you know, kind of tagged the other, like, this is a great idea, and it was.
I also think that there's more services in the larger communities of, particularly Hanover, Lebanon, for people than there are in the most rural, very rural district. But there also could be interesting to know what the stats show on some of that. And then your area is covered sort of by a lot of things around. Like, yes, yes, that's, yeah. A lot of Lakes region kind of connections.
Yeah.
All right, well.
I just have a couple of. TLC,
It's new.
okay. Yes, I remember a TLC, I think down in Claremont.
That's what it is. Yeah.
Yep. We used to fund them.
We did. And then we stopped and they've applied again. Is that the situation?
I guess I wasn't on when the last time we
Sorry,
funded
yeah,
it, but it
I
was.
went
new
down there
to
and
me.
had a really good conversation with them in Claremont. Okay. And families flourish, that's new.
Adapt is new as well.
Yeah. See if I can,
The families flourish, did we find out if, I mean, I was trying to read that and remember what. That's the one that, this is their year of implementation, right?
Yeah. I went online to read about them and it looked like they've gotten all the permits and whatnot, and it appeared they were building, but I didn't see
Right.
anything after like Q3 of 25
Right.
of what was
Yeah.
accomplished when, you know, in all the information they wrote, and then I went online and it was, went some online, but they had a lot of information up to Q3 of 25.
why can I not find it? I found it.
It was a separate one we got.
Yeah, here it is, right here. All right.
In Archways, we funded them before, but was it a different?
We did it
name or
through opioid abatement
Yeah, they were
last year.
funded through opioid abatement.
Right,
It says
but
that.
before they became Archway, didn't Archways pick up the?
Yes.
They picked up Plymouth Family Resource or Plymouth
Yeah.
Family something.
Okay, yeah, that's what.
They're in Franklin, right?
Well, they have a place in Plymouth also.
Right, but it was a different name.
Yeah, right.
Okay.
Right.
Same as Lakes Region VNA on line 240, that used to
Was
be.
the,
Vienna.
yeah, that's what I have that question, so.
I saw, it was interesting that VNA didn't put in an application. I saw they were just acquired by Dartmouth Health, so.
Wow,
Oh.
wow.
Dartmouth Health visiting nurse or something like that.
Should have happened a long time ago.
Yeah, because they serve a huge area.
Dartmouth Health, like everybody.
Yeah.
Okay.
All
Well,
right,
it does
so
seem
that
like a lot of
moved.
the hospitals, that they're part of, the North Country Home Health and Hospice a few years ago became part of North Country Healthcare. Was a separate agency.
All right, and the HIV, we fund them every year.
From the opioid fund this year is how we funded them.
So how do we want to start? Should we talk about I have 4 that I think, we can do wholly out of the opioid fund, and there were a couple that I didn't know if there was be a potential to split
Okay.
it between, our budget and opioid. I don't know what you
gonna
came
say,
up with.
I think if we talk about the ones that are potentially
Yeah.
opioid, that
And how
helps
much
us.
is left?
183,000.
Thank you.
I thought it was 178. What we talked about the other day. Maybe I.
That doesn't include, that doesn't count for any obligation or disbursement for the jail for the things they have in their budget either. So I think that was like almost 40,000 they were asking to fund out of. In that case, it would only leave you 143,000.
There's only 143.
Let's use that number
Yeah.
today.
We do still plan on doing the jail stuff and then,
Well, just for our purposes today, I don't
Yeah.
think we want to use a number that we might have to. Do
Okay.
something with later. All right, do you want to start with what you have and I'll
Um,
start, but
So we'll go to, I thought, ADAPT, could go, they talked a lot about substance misuse and that I know they have the restorative justice. So I thought ADAPT could be,
what district is that?
that is,
Woodstock.
yeah, and they cover some of Plymouth also. The main office is, well, I think it's there's some in Woodstock and then there's also a Campton address, but I think that they do different things out of different places. And that's a team, and the title is Restorative Justice and Diversion Coordinator. Is what they have, and but most of their what they had in their narrative, when they were asking about it, it says they did all what they were doing, and it said aligning with New Hampshire's opioid abatement priorities.
So this is not only new to us, it's a new agency.
No, they've just never asked for us before, but I think when Katie stopped doing,
Oh.
Katie CADY, not
Yeah, yeah,
me,
yeah.
stopped doing restorative justice, then they saw an opportunity.
Okay, thanks.
I don't know why I'm not finding them. I don't know, maybe that was one, was that?
It was one that was handed separate.
Yeah, maybe it didn't make it in. And I'm talking about it, but I don't find it, so.
Yeah, it was given to you out when we got the application, which was after the rest of it.
Okay,
Um,
so how much is that one?
they requested 25,000.
Which is the same funding that we provide to Valley Court Diversion and to Katie.
So it is equal to, or fair, whatever. Okay. All right, what's the other one?
I also thought that Families Flourish, Northeast. Would be an opioid fund possibility, since they're doing recovery services for women and families.
Treatment, right?
And treatment,
Yeah.
yeah.
Definitely. Thought that was,
Um,
I did have a question for Julie. There's no signature and just making sure that they actually,
Yeah.
that their people actually know that this is something they're
Who's
doing.
the name on,
And I couldn't find a board.
who's the name that's?
Bethany Cottrell. And they had several letters of support that were good, but wrong that I couldn't find the board. They did have a certificate of the state.
And it looks like they're not quite providing services yet, and that was my question. It looks like it's still startup costs.
But I do agree, I thought they were clearly the treatment and.
Right.
And we certainly used opioid funds for other startup costs.
I think that it would be important for us to know when they plan to open
Yeah.
and provide services, because I don't think we want to start providing funding before they're providing services.
That was my question, and I didn't find it in any of their literature.
Yeah, I read it over too, and I mean, it's clear that it's ready, they're just about ready to go, but I couldn't.
But I don't know if they have a space yet. So my, on mine, it said, excellent application, when will building be done? And are these startup costs? But it looks like a great program that in the future, I hope we have, if we're not doing it now, it seems something that meets all of a lot of our priorities.
I don't think we've had one of these. There was one like a C something, I can't remember, outside of Concord years ago. Then that closed. It's like they go up and down with whether there's Medicaid funding for it or not. If there's any funding or insurance funding, and
I can certainly follow up with Bethany and ask those questions and ask for a list of board members.
okay, thank you.
And then certainly the ones on my list were the ones that we funded last year, Archways and the
Yeah.
HIV, HCV Resource Center.
Yep.
Then there were things like the TLC.
Do you want to go, can we
Yep.
just go
Oh,
through
yeah,
those?
sure, sorry.
Trying to find Archways, yes. If there was any questions.
And their request 20,000 was the same as we funded last year.
Yeah.
Down at the bottom, it said for Archways, it has a opioid.
And so they do a lot of case management and harm reduction. I don't even think it was 10,000 on, oh, that's the HIV one, okay.
Yep.
Yeah. And then Archways does really significant programming. I was really impressed with just how much. The legal system involvement, county jails, youth.
And of course, the bulk are from Plymouth because it's located in Plymouth. But there's a smattering throughout the county up, Haverhill, Littleton, but then Bristol, Alexandria. Haverhill.
Yep.
When I visited. Oh, okay, yeah, just the recovery program, because I was gonna say the TLC Family Resource Center, there was a whole lot more to it outside of recovery, but they're asking for funding for the recovery.
They do a really significant
They sure do.
job, yeah.
And then the HIV,
Yeah.
they asked for the same 10,000.
They're really terrific. Happen to be in my territory.
Next.
But if we want to go to, if we're looking at HIV, the TLC Family Resource Center, they had requested 7,000 for recovery services and 3,000 otherwise. So it seemed like we might be able to
7,000.
divide that out.
Okay.
I didn't know what other people thought on that.
I thought the family support was also part of the opioid. When I read that.
Yeah, they had it I have to find it, they had it written out separately, which is why
Same packet?
yeah, the same packet, but on the, I think it's the second page when they were, oh no. Yeah, so, on the, on the front page where it says request is
Yeah, yeah.
7,000 recovery program and 3,000 support program. And I didn't know if we wanted to, how we wanted to divide that out.
So when I visited them in Claremont, what I was trying to say before is that the family support program was very impressive, but it wasn't necessarily opioid related. It was,
Okay, I thought it was.
training support for new mothers,
Yeah, they have,
family counseling, that at the time, was could be definitely independent of opioid use. So I think
Yes.
it would be a good
Ah,
idea
okay.
to separate it out.
Right. I don't know why I thought I read something in the letters about family
Okay.
support.
Well, I think
Protecting-
it certainly overlaps, but maybe not separate.
Right, for families impacted by incarceration.
Right,
Support services focus on strengthening protective factors, reducing trauma, stabilizing home environments by providing parenting support,
that was it.
trauma-informed family engagement, assistance during periods of separation and reunification, prevent intergenerational justice involvement.
Yeah,
That's not okay.
Okay.
so, but if we could divvy that out,
Yeah.
there's 7,000 that they were going to direct towards the recovery program.
Mhm. So Julie,
Is that
I'm sorry,
possible?
will you just remind me?
Remind me of.
Yeah. The TLC Family Resource Center. I remember funding that. I remember extensive visit with them. They were an impressive program. And why weren't they funded last year? Or were they funded out of opioid last year?
No, they haven't
simply-
submitted an
they haven't
application.
submitted an
We haven't
application.
Funded them for a few years.
I didn't think
But I
so.
think that initially was a choice made by the board to stop funding them, and I don't remember why.
Or maybe
when
because
that was.
Maybe because it related to children, because we restricted ourselves more to our statutory requirements, which were frail elders, and I don't know, I'm just, so I'm gonna suggest, so I think we can take 7,000 out of opioid, but I'm going to suggest, seeing this happen, and I don't know that anyone is gonna agree with me. But I've seen organizations forget to ask for funding or not ask for funding, and then come back and ask for funding. But I've seen that they've survived just fine without Grafton taxpayer funding. So I am thinking, especially because it's a difficult season, I am thinking of property taxpayers in Grafton County. And this happened with another agency a long time ago. The gentleman forgot to apply and they're still thriving, and it made me feel like, so you don't necessarily need property taxpayer money. So I'm gonna say the same thing on this, and I'm totally prepared to be in the minority on that. So I think we should fund 7,000 out of opioid, and that's that.
And I will say most of the requests that we get are small, and so it might be individual programs that may suffer and not a whole agency. There's many of them that, like, if you look at, just because it's on the top, the TLC Family Resource Center, the amount they're asking for is 0.41%, as we have a number of others who are in the low single digits of. So it may be a program that suffers and not necessarily a whole agency, is what I'm saying in terms of it, why agencies stay when we don't fund them.
Yeah, and I don't want to address that because I think we could make that generalization to all of our organizations in the county. But I would say in this case, their family support services are focused on preventing intergenerational justice involvement
And recidivism.
and recidivism.
No, I know,
Yeah.
yeah, I know, I, like I said, I had a very good visit with them, and they do work, but they were not funded for a while, and they're still here. At the risk of sounding like the Yankee that I am,
I would just say it's been an incredibly difficult year and a half for any kind of not-for-profit that's doing any kind of health and social work, and particularly those that are trying to help people who might fall into what is called the DEI, and that would be almost anybody that's not a white male, frankly. So I think when we look at low-income people, we look at women's services, we look at things that help people who are, as I said, not that fall into what we call diversity in our state. in our country, those that have had their money pulled. Whether it's health or social services, those organizations are all suffering, and many of them have closed down programs, maybe not their, but we just,
Understand.
the North Country Health Consortium has lost hundreds of thousands of dollars.
Hundreds of,
provide-
so, thank you for that. And I'm just trying to clarify. So
Yeah.
the federal government no longer provides funding for any sort of program that they consider to be DEI.
Yeah,
That might have, that might serve a,
and those
Population of
diverse
people of
populations
color?
that are being put into categories, large categories of, lower income people or women's services. Certainly only have to look to the healthcare, rural populations.
And two of these we have in here, WISE and Voices Against Violence. I know that I spoke to someone who worked for one of those agencies and they were rewriting all of their literature because when it was written, they used women a lot because the, violence,
Against women.
against women, even though they will serve any domestic violence, but they were having to rewrite all of their submissions so it didn't have woman because the AI was finding that, that was part of what they were looking at to go through their
Reduce
algorithm
funding,
and take
right.
it out. So it's not,
okay.
and they
Thank
weren't
you.
even necessarily perhaps looking for one ethnic group or whatnot, but it was how they were called. And so, and I do believe that although we look at elderly and disability, I thought recidivism was the other arm of
It
our
is.
social services, which is what the TLC
Oh,
family
yeah.
support
And that-
directly.
Right.
So,
And that wasn't, and I appreciate that. That wasn't part.
so
of
I would suggest before we
Just
start
ask another
calling them,
question.
go through them.
Yeah, I just want more education
Yeah.
because I appreciate what you're telling me. So if I have an organization that primarily, if I have an organization and most of the people that I provide service to are, say, lower income and say they're persons of color,
Mhm.
then chances are pretty great that because it wouldn't be based on income, but suppose persons of color populated that category more, I might have lost funding.
Yes.
Yes.
Yes. I think what's the most disturbing to me is the fact that, after years of building up services for substance use disorder types of things, so treatment and recovery being built up, and Medicaid being provided so that we get all those people back into the workforce and back to taking care of their families and so on.
Okay.
Those have been hit really hard, very hard. And so, the expectation is you're gonna see more people involved, justice involved, and more families involved in that sort of thing, as we take that away. And I know that's what many of our substance use disorder treatment and recovery programs lost lots of money. Now, some of those came back through the court orders that stopped that from happening, but I think the damage was done in others that.
So is there any, thank you. So then is there any chance of finding a strong link with TLC? Because I was certainly in favor of the 7,000. Is there any chance of finding a strong link to fund it all through opioid then?
I would do it that way when I read it, but I know you read it.
So I just read it differently, and I was thinking, it's 3,000, and I did have some thoughts on some other ones, so and the thing we have to worry about is, next year, if we don't get opioid funds in.
That's what
we
I'm-
won't have,
I'm worried
but I
about.
don't want to not fund someone on the idea that maybe I can't fund them next year.
I would say the prevention strategies that they use at the Family Resource Centers, and these are all of our we have
Yeah.
a lot of family resource centers and they struggle with funding all the time, but
Okay.
I think the family support that they provide is part of that. Making sure the parenting involvement is there to help prevent kids from you know, going into, using.
The
substances.
children are supported.
Right.
You support the parents in order to support the
Right,
children.
exactly.
And if we think we can use it, I'm in favor of the 3,000. I just wasn't clear whether it would be opioid funds.
it.
That was I wanted to fund what they asked. I just didn't know how we split it up.
So we could look at the opioid, the letter that we have
Yeah,
that
yeah,
describes
yeah,
that.
yeah.
Okay.
And you may very well be right.
Yeah.
You're probably a little.
What I was reading was clearly the letters from letter of support from Lebanon,
Okay.
which really described the kinds of things they did, but, we could also, we always go back and ask them for more, but.
Yeah. And I just read the program alignment reducing entry and recidivism, but I guess if you're
Well,
looking at
that's-
entry, it could be through the substance.
Yeah.
So,
Okay. Thank you for all that information.
and I had one other, I think I only had one other that, and again, I thought it might be, somehow split the money, with the bridge project in North Woodstock. They do, recovery, and recidivism was, when they, Ms. Schamberger, who wrote the narrative, I believe, talked about, the bridge project's all recovery program, but there were other things they do that are not related to opioids. So, that was another one I thought we could.
Yeah, I had that note on there too. And this is the one that is Representative Stringham's.
Yes, it's in his district, and they've done really good work on a really a shoestring budget.
Yeah, there's something about Lincoln Woodstock is they really find a way to use community support and
Right,
resources.
right, and she listed out, I mean, they have, their total budget is, 190,000, and they've listed out the towns, what the different towns and, other groups have donated to them, so.
So what were you thinking?
Well, they requested, 17,500, they got 17,000 last year, and I thought those few dollars we're gonna get to at the end when we see what our total is, but they asked it for about the same, and I wasn't, and I didn't know about whether we wanted to do it half and half, or check with them on what they think their percentages are. Because some I did not think were opioid related, but their, all recovery definitely was.
Mm-hmm.
And they definitely have some people who have been involved, in that situation, so informing them.
So I think those were mine that I came up with, that we
The
would.
split.
Yeah.
So we're thinking it should be split between opioid and other sources, so.
Can we do that?
It's more work for us, but of course we can do it.
So
What were you thinking, Lorraine? And
Oh, and that's what I wasn't sure as I read through, I wasn't, they gave just examples, and I don't know how they, divided. I do know that through my professional career, I had a number of patients who were involved with this project, both as, clients and as employees or volunteers. So I think that I would think maybe we could do half and half.
mhm.
what's half of that number?
It would be,
85?
8,000, but, 750, is that right?
Okay.
It's done, I'm just gonna call it dates and.
Yeah, if we were doing the 17.5, it would be 8,750. If we're gonna do 1,700, which was last year's, it would just be the 8,500.
I would suggest that you decide whether you're gonna increase funding to agencies before you,
Yeah. Can I,
because lots of times we level
We end
fund.
up-
Right, and that's what I was saying, is if we did one versus the other, so.
yeah, I wanted, that's what I wanted to speak to, so. Commissioner McLeod, is it okay if I talk about that now?
Do you want to talk about that now?
Well, I think Julie just said.
If we
that
want to figure out about level funding or increase.
Oh,
So that
okay.
we know
All
what
right,
we're,
sure.
so I am concerned about that. There's some really substantial increases.
Really?
Um,
I didn't look at it this way with it because I didn't have this in front of me.
yeah, so like, so 230 Pemmy Baker goes from 9,000 to 25,000. But their actual is 2,250. North Country Home Health goes from 35 to 40. There's some really significant, there's some smaller ones. West Central, who just cut our, raised our rates or whatever for the DOC, goes from 22.5 to 40.
Mhm.
Pathways, I know that program goes from 15 to 22. So I'm just gonna say this, and that is, Bridge House, the homeless shelter, goes from 20 to 50. I know we're taking some out of the opioid settlement, and I appreciate that.
Not for the Bridge House.
I know,
Oh,
I know,
all right.
I know. I'm just talking about.
Okay, I thought you
Yeah,
meant
no, let me just,
because it- yeah,
yeah. My goodness, Voices Against Violence from 9,500 to 25,000. I think that based on everything that we're hearing so far, in terms of people costs, personnel costs, my guess is that we're going to be asking the taxpayers for a lot this year. And so I would suggest level funding. I would suggest level funding, and then we can talk about the new agencies, especially, so it's ADAPT, Families Flourish, and TLC, and those can all be taken out of opioid, right? Okay.
Probably.
But I think unless a new agency cannot be taken out of opioid funding, I don't think we should fund them, and for our existing agencies, I think we should level fund. That's what I wanted to say.
Okay. So noted.
I will,
Yeah.
I will say a lot of the applications were aspirational, and I think a number of them were aspirational.
Yeah, I agree.
Last year also, when we decided the amounts of money. In terms of the Penny Baker Community Health, it looked to me like last year, they, just like this year's Lakes Region VNA, requested 9,000. That was for, VNA services. The Penny Baker Community Health, looked like they increased their dollar amount more to the North Country Home Health and Hospice, and they offer perhaps a wider variety of services, which was a surprise to me when
Yeah.
they requested such a low amount in the past. So I think that we're looking, and I think some of the other dollar amounts are to what we were talking about in terms of people losing so much funding. They're trying to block some holes. I'm not sure we have money in our budget to fill all those holes. Matter of fact, we don't, but I think that we can look at, so again, the Bridge House, I believe last year asked for significantly more than we gave. And last year when we went through, we were funding as cohorts, if I remember right.
right.
You know, the housing did this and whatnot. So, I think that we can, you know, I would look at it that way, and not necessarily think to fill everyone's request, even though that would be great, but So looking
So
at that.
my comment on it is I think, I wanted to be reminded of what the cohort funding amounts were, because there was a reason why we did what we did, and some of these folks maybe are coming back and looking at
Hmm.
what somebody else got funded,
Yeah.
I don't know.
Yeah.
Mm, mhm.
But I was trying to remember why, we did what we did, and if there are any things we need to sort of level up or not. But
Mhm.
yeah, I guess I was thinking more in the terms more along level funding myself.
Yeah, me too.
Okay. But level funding at their amounts unless there's some discrepancies. And so I'm looking at level funding by agency as opposed to
Mhm.
level funding by, because I don't know what the total will be.
Right.
Oh, yeah, level
Yeah,
funding
yeah.
by agency.
Yeah.
Yeah, that's what I was.
Yeah,
And I
so-
just want some reminders about why. So we look at the VNA, North Country VNA, Pemmy Baker VNA, Lakes Region VNA. But is there one more?
Well, it was the visiting nurse of Vermont, New Hampshire, but they didn't
Okay.
apply this year.
All right, and so we do have a significant difference between what we did with North Country and Pemmy Baker. Was it related to numbers of people that they serve?
It's was related to the fact that Pemmy Baker's never been funded at the level that we funded. Those other two agencies at, and so in order, like. They're different types of agencies, so. Just let me go back to fiscal year 20.
I thought maybe.
And
there
I'm
was
not sure they're
significant-
different agencies, but it's what they asked for. I think Pemmy Baker just asked for the lower dollar amount for their homemaker program.
So we
And now you're
may,
saying they've expanded.
well, we may very well have sent them information that said we're funding, the VNA home health at a certain level, and they had not.
And we will be
Now they're
taking,
asking for it.
and we will be taking 35,000 that we gave to the visiting nurse
Right.
of Vermont that we're not that money's not being, we don't have to give that money to them, or they're not expecting.
Well, that's why I'm wondering if they need to be leveled up in some way.
Yeah.
But I want to look at the numbers of people they serve in our county.
We used to fund them at 10,005. That was their request, and that's what we funded them at. Then last year, when we did the standardization, we set those, and Nana was also a very small rate.
right.
That we funded, I think 7,500 is what we used to fund Nana at, so
Mhm.
9,000 was the amount we came up with last year for those agencies. The homemaker,
Right.
because it's just a homemaker piece of,
Mhm.
I mean, how do they say?
Where is Nana on here?
It's now Lakes
Region.
Region.
Lakes
Oh.
Region VNA. So they're asking, 240 is Nana, they're asking for the same amount. So why would we increase if it's just the homemaker LNA for Pemmy Baker? Why would we increase that? Why would we try to increase that from 9,000 to 25,000 if that's not historically what we funded?
So
them?
Lakes Region serves 255 people in the county.
Okay,
Pemmy Baker serves
They have 93.
93.
it's getting
And then North Country,
93 and 125
And
740.
740.
for who?
North Country Home Health.
Well, that
And I
makes sense.
guess that's why historically, when they've put in their own request, it's been much less than what North Country Home Health has asked for.
But Lakes Region is doing a pretty significant number too. That who asked, they only asked for 9,000. Yeah.
Right.
Well, I would think to level fund the North Country Home Health and Hospice at the 35,000 and not go up to the 40,000.
Mhm.
But again, if you don't ask, you don't get. So
Mhm.
yeah. And I think if Pemmy Baker or Lakes Region had written their application differently and were offering other services for what they're asking us
Okay.
for, it would be different because they are keeping people in their homes, which is one of our goals. But with the numbers as much as, and I think Pemmy Baker is a great home health agency, but looking at their numbers and what they've asked for does not warrant the
Mhm.
increase from 9,000 to 25,000.
But it does, given what Lakes Region is doing with a whole lot more people. On, you know what I
Right,
mean?
no, right,
I mean, why don't we increase both of them to 15 and,
But Lakes Region hasn't asked for it.
yeah, I guess, I know we said that last year too.
Well, I
It
just,
feels like we're under,
I think that they are all looking for funding and these services, these home health services absolutely keep people in their
Yeah.
homes. And
absolutely.
saves us a lot more money. I would be more than happy to go up for both of those, even if they didn't request it, because I think it will support those programs. And if we're looking at our home health, we have, if we're looking at it this way, 35,000. So if we increase from 9,000 to 15,000, we're still saving monies from our, if we're looking at the home health. Does that make sense to people, what I'm saying?
it does, but, and then I just want to point out too, that Lakes Region Community Services, that organization is a CFI provider. They're also doing that home health and but we funded them at 20,000.
And I think they're doing a little bit I think that the services that the VNAs are offering in terms of homemaker services are a little bit different from what the Lakes Region Community Services are in terms of their direct service providers, which I don't believe the home health agencies are. You know, they have people
They're
go in
doing-
the home, but Lakes Region Community Services help people to stay in their home and be part of the community.
I'm fine with that. I still have more of the opioid funding.
Yeah.
Oh,
I want to
yeah.
talk about. but
Yeah.
We've kind of got off on
Yeah,
this.
we got off on a different tangent.
But let's put that down as a suggestion anyways, the 15 for those two. And see where we end up.
Yeah.
Can we just keep going down through the list? Cause that
Yeah.
makes it, and then when we get to the
Sure.
agencies
Okay.
that you wanna.
So we're going to level fund some, but we're not going to level fund all.
Well,
We're
I
gonna
think
try
that's a
to
starting
level up.
point.
I think we're leveling up,
A couple of
leveling
them.
up a
But
couple.
what I'm saying is that just in terms of uniformity, I don't know that one agency would appreciate being level funded and while another agency is increased. That's my,
But we're still talking about say a cap of this 35,000 is pretty.
where were you talking about?
North Country Home Health and Hospice is asking for 40.
Mhm,
They're
mhm.
going beyond the amount that I think most of us are.
So, okay, I understand. If I could just say something before we continue on, it seems like, and I mean this respectfully, but it seems like we're trying to make their decisions for them. It seems to me that we have applications, and we've got those applications. They're the people who run the organizations. And then the commissioners are coming in and saying, no, you don't need 9,000, you need 15,000. So I don't know that that's, I haven't, this seems to me to be a little bit unique to the social service funding. There seems to be more advocacy, going on than say we have with any of the departments that we fund. And so I'm just concerned about that, but I'm concerned about saying, okay, so I'm a commissioner and I know what you need more than you know what we need. And I think we have a big problem. And so I think we need to fund it. I'm just concerned about getting out of, I'm trying to think of the word I'm trying to use. I don't know if it's the objective realm. I'm not sure. But I think we're putting a little bit of a wish list onto them.
And is that any different than saying they're asking for 25,000 and we're saying, sorry, but we
Where?
give you 15,
Where,
like Pemmy Baker.
Pemmy Baker, I think we should level fund. That's what I think we should do.
But I guess what you're saying is that, I guess what I'm hearing, so they requested 25,000 in
Right.
their new application. And so, and we're talking about level funding. So I think we're looking at things just from.
Oh, I see what you're saying. I'm sorry.
That they did make a request.
I see
for
what you're saying.
25,000. And we said, no, we can't do.
I understand.
25,000.
I understand. And thank you for that correction. So let me address that. I'm representing the taxpayers. And so I understand what you're saying, that, so we can, not increase, we're putting our own perspective onto things or whatever it was that I said before. I'm representing the taxpayers and I can't, when somebody has a $9,000 request, I wouldn't do that with a department. If the jail came in and had a $9,000 request, but their actual was $2,250, I wouldn't bump them up to 25. And so that's where I mean that I think that the commissioners are almost playing an advocacy role for this particular budget that has not been played with the other departments. And I would just caution against that in terms of making a case to the taxpayers. And so, and I'm in the minority and that's fine. But for the minutes and for the public, I think we should level fund.
And can I just address the
Yeah.
2250? That is the 6-month actual, so that is really has no bearing on what we're offering, what we're doing for an organization, because that's just what we've written them
We've
a
given
check
it.
for. It has nothing to do with anything else. And I think we're all representing the taxpayers and we're all representing the needs that we see in the county and my goal is to keep people out of the nursing home that can stay at home. It's huge choice for people and it's
I understand.
awful to not have the services that they
I
need.
understand.
And this gives these organizations an opportunity to actually help people stay in their homes that may not otherwise get
Yeah.
services.
Thanks for
from
that. Thanks for that correction on the 6 month.
Yeah.
That's just simply what we've, can I just please,
Mhm.
that's just simply what we've dispersed. And I think you're right. We're all representing the taxpayers. So I think that I am particularly sensitive to the people who are not necessarily requiring services, but that are on very limited means. I think of the people in my district that are on very limited means. What the heck happened in Lebanon not too long ago? But a lot of fallout over the rising property taxes. Everyone's being hit. And so I think when I say the taxpayers, I guess I should restrict it to that. I'm concerned about the taxpayers who aren't necessarily using these services right now, but are funding the services and they're on very limited means, whether they're retired or whether, it's somebody who works a $10 an hour job in my district. I guess that's when I said that's what I'm talking about. And I completely take your point, Commissioner. So that's all I wanted to say.
And I would like to just say, I agree with Commissioner McLeod. I think we're all representing the taxpayers. And I think we went through the nursing home budget this morning and we look at how the county funds and the cost of people being in a nursing home. And this is a way to keep them at home and not in the nursing home, which
I know.
which would have them, both the people and the county incur even more costs. And this is a
Okay.
different way to keep them at home.
And I think just have to say this because I read the Union Leader every morning when I get up in the morning to see what's going on, what they're saying anyways. And there was a above the folds on the front page story about the Merrimack Town Council really lashing the state legislature as a bipartisan effort to say, you are the people that are actually increasing our property taxes. And they went down through how that was happening and what,
Interesting.
yeah, and very upset with the issues that the cuts that they've made to revenues that are impacting the
Yeah.
services and funds that they were
Earned
able
income,
to,
earned income. I know,
that are able to, and how the huge impact that has on the property taxes going
Yeah.
up everywhere. And so I think we have to be clear about what's actually causing the significant increases that we're seeing, and that's part of it is they're artificially reducing the revenues in our state so that they can try to reduce some of the expenses, and it's impacting, those services still have to be provided.
That's interesting what you just said. What do you mean? What did you read or what are you talking? I'm interested in what you're
Well,
saying,
the
that they're
interest in-
artificially
Artificially meaning that
reducing the revenue?
they are reducing the revenues in our state, that those revenues are still needed.
Oh.
So they're
Oh,
taking money that is coming in. that
Sure.
People pay for things that are expected to create a society where we can all live.
I didn't understand
And
what you meant.
now they're taking those things and saying, well, we're not gonna let, the wealthy people in our state don't have to pay for things. Only the low income people have to pay, and
Well-
we're gonna do it through our property taxes.
I agree. And I think that there was enormous bipartisan, at least the people who I talked to, enormous bipartisan, Republican and Democratic dismay at the elimination of the earned income.
The interest in dividends.
The
tax.
interest in
Yeah.
dividends. I think there was a lot of dismay
Yeah.
over that.
Except by the legislators who pay those taxes, who were quite glad that they no longer had to write those checks. And I heard that from one of our senators say that at a public meeting.
One of our state senators.
Stated that I wrote my last check to the interest and dividends tax in New Hampshire, and I'm glad about that. And he also had to vote on that.
Was that a Grafton County? Not
Mm-mm,
Grafton
no.
County.
Rochester senator.
I know who you're talking
He
about.
runs the finance committee in the Senate.
GR.
So
I've heard him
anyway,
say that.
we have a lot, we're
That's fine.
we're just trying on
That's fine.
very little
That's fine.
level here to keep people in their homes and out of our jail and off drugs and,
It's fine.
All the world.
That's right. There you go.
well, just our
If we
local,
can do a little bit.
That's what I meant.
yeah,
That's all our worlds.
our world's problem. You asked if we could go down through,
So Lakes Region Community Services.
TikTok.
yes,
They were,
they're an incredible agency.
yeah, and they just requested level funding.
And I would say the majority of what they do for us is the CFI population, which is directly the home community based.
Yeah.
And younger people with disabilities, and the traumatic brain injuries and the neurodivergent
Who are either on the CFI
Yeah.
program waiver or
Yeah.
the brain injury.
Yep, absolutely. Yep.
Common Ground, Northern Human Services. So we do have in each of our districts, we have the mental health services folks. In this case, they have two separate ones. One is that population of folks, disabilities, and the other is the mental health, community mental health services that they provide. So I think it got broken out.
Yeah.
They did answer that they do serve people with opioid issues, but it's not, did not seem to be, it's not their major.
Yeah, I didn't see that we could divide it out enough when I read it.
Right. Yeah, I agree. And then you have your Lakes Region Mental Health, which is a similar. Was there something?
The level fund, North Human Services.
This is the first pass.
Yeah.
Okay.
And all of the next three are the mental health that we funded last year at 22.5.
Suspect by Lakes Region if there was anything. I said they were missing information. They serve a lot of people, 604 people in this county. Did anyone else find they were missing? And it could very be that my application is just missing, but I didn't see their board.
I had it on their second page or.
Oh, you
their
did?
third page.
Okay,
Yeah,
backwards on something. Okay, I might have missed it. Or I'm just missing the page.
you might be just missing the page.
Okay, so it was there. All right. And I think they also mentioned opioid, but not in the sense we're talking about it. And then we have West Central. Hmm,
Hmm,
oh my God. Right?
And again, they had a huge request, but this year it was we did the 22.5.
Right. We were keeping them all same.
Right, and we used to fund them at the level until last year when
When
we
we
went
cut
through and
back.
did the standardization, so.
And didn't things get cut overall? We did a,
No,
that was the
That was the
one
year
thing.
before.
Okay.
And if we look at the Grafton County total, their total was only 403, where Lakes Region was 600 something. But I think we could keep those, I would suggest of level funding, they all ask
Yeah,
for a little bit.
You
more.
know, I suspect that 159 in Haverhill may be our jail.
Could be, that we pay them for.
yes, we do.
And I did not think of that. I'm like, that seemed like a big number when I looked at it. Like,
Yeah.
like
Out of the
more in
area.
Haverhill than Lebanon. That seemed, yeah.
Okay, so we're gonna do that 22.5.
Yeah.
Pathways. Where was that? That was,
And it was for disabilities and they, with employment options, and they requested an increase to 22,000. From last year, we did 15,000.
Right, we did 15 for all the developmentally disabled agencies.
so that's in your area.
it is, and I feel strongly that, that Pathways, should be at 15,000 for that program. It is my area. Visions is also my area. And I think, I just, that's my strong feeling under Pathways.
All right, that's clear with everybody.
Yeah.
Right. Great. We have Visions, again, that's the
Level fund.
DD population.
Mhm. They do great work.
I didn't have any questions on
I
that.
didn't have any questions.
All the Grafton County Senior Center
Yep.
services.
That one, right.
So
That's-
that's the level funding on 3 of them, very small increases on
With the RSVP.
social services.
The
And that's,
RSVP problem, the problem was that they cut the funding that state in the state budget on that program.
They did.
Yes, and then we have asked for to bring that back and it's been tabled.
and the social services, I mean, it went up by $2.
I just wanted to point out today, when two things. One is, if you look at their annual report
Mhm.
and you look at on the second page at what they do, and I just want to
Yep.
encourage people that this is probably one of the best volunteer
I agree.
organizations
Yeah.
to work.
I have-
to do some work for.
I have nothing but respect and a pretty deep knowledge base
Yeah.
of Grafton County Senior Citizens Council. I think they use every penny. And I'm interested in what you said, that the RSVP was cut by the state.
And I would just encourage anyone and those even online who wonder about our services and the people who need them and think that maybe people don't, that if you go do Meals on Wheels delivery,
Yeah.
even one day a week,
Yeah,
anywhere in the county, you are going to understand the needs that people have. And those who are trying desperately to stay in their own homes and age in their communities as opposed to coming here. And you'll see people who probably should be
Mm.
in the nursing home, but is finding a way to
Yeah,
stay.
yeah.
But a lot of what they do, and then I did want to mention, you probably all got this, but they're having their
Oh, yeah.
annual, meeting.
Yeah.
I think it's next week. And it's 11:30 at the senior center over here. Oh, I don't think I got that. Oh, it's Tuesday, the 14th at 11:30. So I didn't know if you
Oh.
might want to, we did put them as our, we dedicated our
Mhm.
annual report. So I didn't know if we might want to show up, have a face or faces there for that. Right around the corner, isn't it? So just a thought, I don't know what we have going on the 14th.
Yes, you do.
Yes, I did. Oh, yes, I know one thing where it'd be on the agenda, but this would be a reason to take a break and go.
Yeah, it's right next door, so.
And I don't think I got that. Well, did that come
Mhm.
here or to your home?
To my,
I don't think I got it.
yeah. But
Good.
Don't know if you all would be.
Next
interested.
Tuesday,
Next.
11:30 to-
14th,
14th,
Sorry, yeah.
2 weeks.
a week from Tuesday.
Yeah. Go have lunch with.
Sure.
Yeah.
Sounds nice.
I can respond for all
You want
of
to
us.
respond
Thank
for all
you.
of us?
I
I was
will.
good. I was like gonna
Yeah.
write the number. I'm like, I'm never
Yeah,
gonna
no,
find
I'll
that
do
number
that.
again. So I would be in support of approving everything that the Grafton County Senior Citizens Council. It was just over the total increase. The social services was up by $66. And the RSVP program, which, as you mentioned, had funds cut,
mhm.
they only requested $682 more.
To adapt.
I'm fine with that.
So adapt, we're suggesting to fund out of opioid.
Yeah.
correct?
Yes.
Yay.
That brings us to Bridge House.
It is, it's in Plymouth.
Is that almost shelter in Plymouth? You're in the Lebanon Pond.
The top is Plymouth.
Yeah.
Transfer Katie.
Boys.
This is. I know it.
It was a pretty thick packet because we got a lot of.
It was late, so you would have gotten it outside of when you got your other, maybe you have
Yes,
another pie
and they,
somewhere.
and they had someone who
These are all
passed
the ones
away,
we
which is
found.
why it came late,
Correct.
right?
Sean Doherty, right? Is
Yeah.
he the executive director?
Oh, well, I may have dropped it. In the parking lot. Oh, here it is, right here. Okay. Yep. No, then into that. Yes, I know. I just thought maybe there was some opioid, because I do case management and a lot of the homeless folks.
I dropped mine in.
I
Okay,
didn't
but-
see, I think you're right, I'm just not sure, there's enough. Well, certainly not in their application, there's not enough that I found that I thought was opioid related. We know that homelessness, people who
I
are
think I
unhoused.
think it was in their 990 almost. I went through this. Describes what they do, in the 990 and. Anyways, that is a question. I don't know if we want to follow up. Given that this is a significant.
And I know they've asked for higher amounts.
Oh,
in
that's
the
what I'm
past That
thinking,
we
okay,
haven't.
okay.
And at least last year, we didn't fund them to the amount that they asked.
I applaud them for asking again.
And there was not so much information in their packet because it was late and it was due to circumstances with their agency.
Yeah, so do we want to,
I think if we're looking to level fund, there's some other housing things that we funded at different various amounts, so.
I must have read something about them somewhere. All right, so level.
Mhm.
Bridge House.
Yes.
Mhm.
Voices against.
And that, again, that's in the Plymouth area and, they requested a large amount. I know they lost funding with a lot of the Doge cuts. Um. But, we funded WISE. Um. We funded them both last year at 95.
Yeah, I did note that they had 463 people from Grafton County, and they do say yes to opioid dependent clients. So I had that little sticker
Yeah.
on there.
And WISE, they have 475 in Grafton County, so the two agencies,
Mhm.
take care,
Mhm.
WISE did not mention anything about opioid. I don't believe Voices Against Violence does any opioid treatment. I think it's,
Okay, all right.
Well, just a, just a question. So I'm for level funding that, but you said that you've talked to them and they lost funding because of.
I think they all
Doge.
probably did because, well, and they were rewriting, this was one of the groups that was rewriting much of their information to make it gender neutral, because with women, they got, I don't know what they got back through the first round, they lost a lot because they had women in their descriptions.
Thank you. Tri-County Cap.
So that description on your spreadsheet should just say Tri-County Cap. Courthouse,
Oh.
this is for their request is for their whole agency.
Oh,
Yeah, and so this was different than what we've done in the past where we supported transportation.
Last year, when we talked about doing the as an agency thing, they submitted their application as an agency, so it's inclusive of all the programs that we have funded them for in the past.
Okay, so they serve 4,000 people in the county.
And they requested 2,000 extra, more. We funded them at 20,000 and they requested 22,000.
And they'll do amazing work.
They do amazing work.
What do you want to do with that?
Well, I'm of two minds, so I'll just say it out loud. I think if we're level funding, we need to level fund, but I think with everything they do, an extra 2,000 is not, it's not going to impact, our taxpayers at where that might really help some people.
I think,
Unduplicated too. Numbers.
I think we should level fund and for me, it's a matter of principle and consistency. $2,000. $2,000. I don't want to say that $2,000 isn't gonna impact our taxpayers, and the reason why I don't want to say that is because I'm working from a principle. So I think I'd prefer to level fund it. And as Commissioner Hedberg said in the beginning, Commissioner Hedberg's first comment, well, if we're level funding, then we'll level fund. It's that sense of being uniform, unless there's a really good reason, which there seemed to be for something else.
I can live with that.
All right, wise we've already talked about.
Brings us to Katie.
Yeah,
They always get the same amount, right? But are they doing, they're not doing as much,
well, they're not doing the restorative justice piece.
well,
And they talk about substance misuse. Most of their information is written about alcohol, although they do
Oh.
talk about drugs also.
so it's Adapt that has picked up.
Yep.
Adapt has picked up their restorative justice. I'm trying to find it real
Yeah.
quick. Tell me where it is real quick.
Adapt is,
It's sort of in the middle,
yeah,
I saw it.
370.
All right, so we're giving them 25,000. Which out of the opioid, which is a good thing. I don't see if they're offering less services, I don't see a reason to level fund them then. That's my thought on Katie.
Just wondering if we can do something out of opioid. It says no.
Hmm.
Okay, so most of it is. They also have 4,000.
yeah, I think though that I think that how they got that 4,000 number is they do a lot of school presentations, so my guess is if they go in and do a school, they count the total enrollment of that school. I mean, and they're in my town, but I think that that may be how they do their numbers.
That's important information.
You know, and then there's a few other scattered ones, Littleton, Canaan, but the,
What
Num-
did they request funding for? Education, is that what it's?
they said, I think it's their substance misuse prevention campaign.
Continued support of the Central New Hampshire Youth Intervention Program.
So if we're giving, regardless of whether it's opioid or not, because there are other demands on our opioid, we've got two other requests, so. I mean, on the agenda today, so regardless of what fund it's coming out of, if we've given. Adapt 25,000, regardless of the fund that it's coming out of, because they do the restorative work. And we know that, I'm surprised that Katie's numbers represented includes every student sitting in the
That
audience.
would be my assumption. I don't know
They
for sure.
work in a number of high schools, though. It's not just Plymouth.
No, no,
Oh, sure
but
they do.
all
they
the
go
way.
all over.
But
Yeah,
then-
that's what I'm saying is the towns that are listed. I don't know how they get all those numbers.
Yeah,
I only know about them because they do a lot of work with kids on advocacy around any kind of substance use. So you'll see these kids at the legislature speaking.
Yeah, no, they do
against
a
things.
lot of advocacy, but they're not doing restorative justice. So I think we need to look at that piece.
well, how much was their restorative justice? Probably don't even know what their restorative justice piece
Well, I
was
think that
last
they're
year.
gonna tell you that
Yeah.
their funding wasn't for the restorative justice. It's been for this
All along.
campaign, this initiative all along. Well, not all along, because it wasn't originally. Originally, it was for the restorative justice program back in the day.
Substance
And that was
misuse
done.
prevention. So this is prevention. I just wish there was opioid.
Right, and they did say no, which is, they don't provide support to opioid dependent clients. They're looking to prevent
Right, it's a
the,
prevention.
it's a
program.
prevention. I don't know. I think that.
Your district. I
It's
guess.
my district. I think that it's a good program. I don't think, I think that 25,000 is high if we're funding them. And I'm not sure whether they do enough in their descriptions that we can use it from the opioid fund.
Yeah.
That's
So what would be an amount?
we don't have anything
Right,
just like this, so
right.
you know, and the Valley Court diversion gets 25, which is how we kind of picked the adapt, and I think we did that 25 because they were also doing the, you know, some of the diversion.
They do.
Right, no, but I mean, that's why Katie had done that,
Oh.
which is why I think they had gotten that number in the past.
It was.
So under the opioid strategy 4 is expand prevention and family strengthening services. You know, I think it's a little bit harder that they said no to the opioid piece because with them saying that, it's harder to, I mean, it does include prevention. That's all I'll say.
And so reading that, that actually gives us the reason that we could do the 3,000, if we go back to the TLC Family Resource Center, because with those words actually fit what they described that they did. In addition to their recovery, so that
It
also.
says support family strengthening programs for children, youth and
Yes,
families
that's
impacted by OUD.
Yeah, so I'm saying, so
Okay.
TLC, we absolutely could do all 10,000 with that, so.
Okay,
Um,
so what does that mean
For-
for Katie?
Mhm.
Well, they work in a lot of although the numbers, that they work in a lot of the schools and go to a lot of the different youth activities for prevention. So I think looking at it in terms of prevention, we just don't have one that's just prevention. So we could look at,
The prevention work that they do is, they don't support opioid dependent clients, they do
But-
prevention.
yeah, but I'm looking, but I would just say, I think the 25,000, we kept that level because they had still been doing restorative justice when we did those numbers last year.
What about doing them for like 15 out of the opioid?
Well, I was gonna say,
Yeah.
let's pick a number out of the opioid fund
Yeah.
and do it. I'm okay
Okay.
with 15.
Okay.
I guess that's the point I was getting
Let's
to.
start there and then.
All
we
right.
can
Yeah,
work.
that's where
I'm starting.
that's what I was struggling to get to, so thank you.
So Valley Court diversion, they've asked for 25, we
Mhm.
funded at 25, that's what
Mhm.
we've done.
Yeah.
So I'd say I'd
I'd be
recommend.
good
So
with
what,
that.
for Katie, it's 15 out of opioid,
Opioid.
15 out of opioid.
Yeah.
And is that it, or are we giving them another 10,000 for?
No, I
No.
think we're just
Okay,
going
good,
15.
thank you.
I'm sorry,
So
so then
those-
Valley Court diversion, you said is, I had them down as opioid. Is that what you,
No.
there was something? I don't think they answered the question, but when I read their stuff, they don't even have the question on their page.
No, why? Because I told you, that's copied, that's last year's,
Okay, that's
Response.
what I thought.
because Ellen's not even, isn't she signed
No.
that? And she's not even there.
Right.
It's literally I mentioned that when we were going through, I'm like, they just.
Yeah,
last year's
yeah.
Application. Didn't put a lot of,
Well, then on the second one, Dan Burgos signed it.
he's the,
He's the new,
all right, you know what, because didn't I copy last year so you could see that they were the same? I
Yeah,
might have done that,
okay.
but yes, Dan Orgo's the new,
Why do I know Dan?
we can't answer that.
I know, but I don't. Okay, well, why did I feel that this was opioid,
but as
restorative
we're,
justice?
as we're totaling up the numbers for opioid, this might be one that since we funded it out of the budget, we keep it in the budget, because we're almost to zero with the opioids without the two that we're addressing today.
The diversion program. All right, but whatever I just put that question mark down.
Yeah. No, and I think it's a good question. I'm just, was in our, budget.
I see, you have our county cap application.
Yep, right here.
Yeah, for a second.
So are we down to,
Down to north, well, we've got Twin Pines, yeah.
I think that's in my district. I think it should be level funded.
and it's for this resident support services, which
Yeah.
is really
Yeah,
helpful.
and Upper Valley Haven also provides resident support for the
them,
Twin
yeah.
Pines, for those residents. And I think Upper Valley Haven as well.
And that's a incredible
be-
program.
They do a great job.
So apparently we didn't get a request from North Country Transit. Isn't that part of Tri-County
Yeah,
cap?
it is.
Last year, it looks like they broke out the,
Well, on the front, did you look on the front of theirs? Was it separate, just separate, or wasn't there another page in there maybe? I just one was a separate page. We've done that in the past. Where they used to do the two, no, that's the,
does it mention transit and
I think, again, I think there's some pages missing from mine, and I'm not saying it's anybody's fault but my own.
I don't have any.
I didn't see anything in mine that I think that showed transit.
It's just, that's strange that.
Usually the two of them are together when we get them. Like they just flip them together. And they have two of the front pages. I don't know. Can somebody check the?
Mhm.
Okay. How about just going to Transport Central then?
I think we should level fund them, whatever, we did that last year.
I think with the money, there's a lot that is gotten out of that. Because it's mostly volunteer.
Yeah.
165 people.
If I added everything, what we've done out of the opioid, projects, except I left the bridge project. I don't know if we're gonna do opioids out of that, but right now, of the ones we decided to, it's, 85,000.
I see, I have more than that. Do you
I
want to?
have way more than
I have
that.
way more than that.
Out of the ones that we did.
We talked about
I have
yeah,
113.
families, that's what I have is I have.
Oh, then I
35.
missed one, then I missed a 25,000, I guess.
I had
We talked
exactly
about
that number.
families flourish
Yep, TLC fam
and
resource.
archways at 20.
Oh, archways, that's where I missed.
I'm gonna go down from the top.
Yep.
Um,
Yeah,
And
I missed
HIV
archways.
HIV resource, adapt, was there anything in between there? Between HIV and adapt?
I don't have,
No,
Okay. And then I had, archways.
and archways is what I
And then
missed.
I know we added Katie in.
Katie. At 15. And then we had the bridge project, 85. right?
TLC.
And and that's
And
my,
this
my
was
question was, did we
TLC.
decide to do 85 at the bridge project? So
With the number
Yeah.
I was carrying.
that was my question.
So do you get 113.5?
That's what I got.
Yeah, I know, that's what I had too, but I. Anything.
Yeah, 113.5.
Okay.
Because I had missed archways and my question was on bridge project, so.
Yeah, I don't see anything in there. I'm sure. Any caps application.
Hmm.
Country transit, like in what they sent us that we would have. That's.
Who's keeping track of the other number?
Yeah.
Yeah.
The number tracker. You're at 448,750.
448, 750 with the opioid funding being taken out? Is that
Yeah.
what you're saying?
That's what would be left to fund out of the budget for social services.
The bridge project, are we doing the entire 17.5?
No, I think we're doing half of it,
We're doing
eighty-five
half of the
hundred,
17,
half of 17, not 7.
so 8,500 out of it, but, out of the budget.
So is there anything outstanding we need to look into? I mean, do we need to check in on the Tri-County?
Let me look at how they submitted it last year. I'll relook at that.
And we were also going to check into Family Flourish to see when they're going to,
Oh, yeah.
whether that's in
And get their-
opioid or
I'll
not.
get their board too.
Yeah.
So Commissioner McLeod, we did pretty similar decisions on what opioid should be.
Yeah. Yeah. Yeah, boy. That really leaves it, does that leave us 30,000?
Right, we get,
Wow.
I just remember it was a little confusing last year because it was two like cover pages, one after the other.
That is last year's. So I'll get the answers to the questions that we have, and when we go through, one of the deliberation sessions, we'll finalize the
Yep.
social.
Good.
well, commissioners, I think we did a very good job working together on that.
I think so too.
Because we were very like-minded, few dollars here or there that, and I thought we discussed that well.
I thought we were very good discussers, very constructive and productive discussers.
Correct.
Of that. That was the
And
thing.
I feel like we learn a lot every time we do this about the organizations from each of you and what goes on in your communities and.
Okay, so after all of that,
The opioid abatement. That
yeah, and I
going.
put them on just because they're they're more follow-ups to
Yeah.
stuff you've already discussed versus new opioid requests, so. Let's start with, Lisbon Fire first. So you had approved last week up to 50,000 for their Zoll cardiac monitor. Which they must have gotten a quote quite a long time ago
Yeah.
for, so when you asked, you told them that it was contingent upon the quote. And they went out and got a new quote, the total for their Zoll cardiac monitor is now 74,404.30, which is obviously $24,404.30 more than the funding that you've already given to them. So they've requested, to ask you if you would consider funding the additional 24,000 plus that they need in order to purchase that Zoll cardiac monitor.
And that's even before the attachments or something?
No, that's
That's
totally
including-
different. That's the
okay.
Woodsville ambulance problem.
Oh, okay. Sorry, ladies.
74,404.30 would be the total appropriation to the Lisbon Fire for their request. You've already approved them up to 50 pending the request for the quote. They're asking for another 24.
And we have, where did it?
40.
We have 40,000.
And the Woodsville ambulance forgot to get funding for the brackets that they need to mount the equipment that you've given them for funding. So they're asking for an additional $19,085 to purchase the brackets they need to mount the
To use
equipment
the
that they
equipment.
purchased. Right.
And we only have,
So-
after
so
what we
that-
did, we only have
That's it.
30,000 left.
I thought we had.
About 40,000.
I'm 143 minus, but we have 40,000 left.
And we have in that dollar amount, with the sheriff, this is subtracting what we think the sheriff is going to want out of, when we got to that 143, that was after what you thought we would need for the sheriff.
For what?
I added the
remember.
opioid fund. You said something about.
We had,
She
you
wasn't
had
gonna be using
obligated.
it.
Oh, so we were
For
going
one-
to use that. So that
Right.
includes what we were going to use.
To
Cause
add
I
it
was gonna
back
say,
in.
I thought that we got money back and then we have to give it back out again. So, okay, so that's what she wasn't going to use. That's the
Right.
question.
So I'll take a stab, and my stab is that I appreciate the change, but I think we should provide an opportunity for another organization with the 40,000 that we have, or another two organizations with
We're
the,
worried that the equipment is not usable without the.
can they get the money someplace else?
But either, and then the other project can't go forward without the appropriate funding.
Right.
That's what I'm worried about. It's like neither of those would.
Well, I will say, I think equipment is a really important thing. I'm not sure $70,000 for one monitor is going to save that many lives, whereas there might have some other equipment. You know what I mean? It's a different in how you're using it.
It's a good point.
And I think we're in agreement that we want to, I'm looking for that quote. Do you know what day did that one come in?
It got sent to me on Tuesday, March 31st. So
Okay,
I'm
I was
guessing
like,
forwarded
okay.
it the same day. but
Okay, then I was back too far. That was my question.
it Just came this week.
How is 143 minus 113, 40,000, and not 30,000?
No, you're right.
We're 30.
So it's 30,000 that we have left, I'm gonna say. Okay, so we only have $30,000 left.
And you saw my email from Attorney Fetty, and it doesn't look like
We're
Right.
we're
get
getting any money until probably September. We should pay
Right.
regular money. We
Right.
may be able to do something with the
With the
if they do an RFP,
Yeah.
but hopefully after Monday, you'll know more about that. You want to think about it till Tuesday? Do you want to take care of it? You let me know what you want to do, but those are the requests, and we only have 30,000, so you can't do both anyways, because there's not enough money.
Not enough money.
And the reason for the change with the ambulance was which is the mounting equipment, and
Wisville ambulance is the mounting equipment for the ventilator.
the other is just an old quote. And so if we can't provide,
I think we should do the mounting equipment now and then figure out.
can I just finish? it?
Yeah.
If, so the mounting equipment was, I'm sorry, how much?
$19,085.
So that was and they just simply forgot to put that in. And so the 24,000 for the Lisbon, that's because it was an outdated quote. And we've already given them, how much?
Well, we haven't
given
given,
them
we
any.
promised 50,000.
We promised 50,000, but I mean, but we promised 50,000, but if, like, I'm just trying to speak to what Commissioner McLeod said. If we can't go 24, then they might not be able to get that. Or they might have to look elsewhere. I'm not sure that we should spend 24 on that. That's the ventilator, right?
No, that's a monitor,
That's the monitor.
which I was looking. My question, and this would be for Woodsville, is have they already ordered the ventilators? Because if they haven't ordered the ventilators, we could we could suggest that they buy 3 ventilators and the mounting equipment. Because it's unlikely that because they don't have 4 ambulances out all the time.
Yeah, I thought
You-
about that.
You know, so if we, you know, and is there a way to do that, to do 3 ventilators and the mounting equipment, which should be more, if, and I don't have the numbers all in front of me, but that would be about similar to the 4 ventilators.
Mm.
And again, and I'm sorry to, and I would like to think about the, that monitor because I, did not go through it carefully enough to see and why it was $70,000,
Oh, that's reasonable. That's a
but
good
somehow
thing.
I'm not finding that email.
Well, and I wondered too, if somebody has a contract that would be back on for that. For this little. You know what I mean? Like there's often a contract like the state has or
Yeah,
some other group has. I'm just wondering.
yeah, there I found my Lisbon one.
I think also it'll give us a week to have more clearer numbers than what our mushy brains have today.
Yeah, but yeah. You know, and I think we've talked about using for equipment, it's one-off, it's not, you know.
Yeah, I agree.
But that's a
Hmm.
very expensive one piece of equipment that I'm
Sure
not
is.
sure how that's going to lend
I
itself.
think that's a very
So-
good piece of information that you're giving.
So you want me to reach out to Renzo and see if he's ordered the monitor, the ventilators and ask if not, if they can order 3 and the mounting equipment and use the money they've already received?
Yes.
And on Lisbon, you want to just hold
I
off?
just wanna
Just
hold.
let's hold off and. We just have to, I think we have to be more clear on what we actually have in that.
Right.
Bank account.
Well, by 4 o'clock today, you will be.
Okay.
I am departing this fine establishment at 4 o'clock today and will not be back until April 13th.
Good for you.
Oh,
All right.
great, great.
All of the external factors that
Sound-
exist. in
sound
my
pretty
world
sad
are
about
just
that.
gonna have to get by for a week.
So the county executive committee meeting, that tomorrow?
Yes,
It
the New
is.
Hampshire Association of Counties meeting. is
Okay.
tomorrow.
Yeah.
All right. Does anyone ask?
Think I'm going to go by Zoom for 2 reasons. One, I have, especially since I am now booked up, looking at the time until somewhere like 8 o'clock tonight. And in Plymouth, Maine,
You are going?
and there may be freezing rain, so I might
Oh.
go
No,
by.
that's what
Oh,
I'm
I
gonna
didn't
see-
even know that.
I think I may, at least up in our area, I
Yeah.
don't know what it is in Lebanon, because it's like, was this weird
Oh.
pink.
It was
That,
definitely this morning on the thing that it talked about freezing rain.
Okay.
So I-
Through 10 a.m.
yeah, so I was thinking of perhaps doing it, by Zoom.
Hopefully
Okay.
it's not, because I plan to be at Dartmouth by 8 AM, so.
Well, it may be along the river.
Hoping you're in neck of the woods, it's not doing.
Right.
Yeah.
In my neck of the woods, did
yeah.
you say, Julie?
Yes,
It's
I'm
not.
headed to Dartmouth. I said I'm hoping it's.
Oh.
Okay.
All right, tell me that.
All right,
You-
Well,
so-
anyways, we may or may not have anyone
Yeah.
there. Okay. Just wanted to check.
Well, you said you're gonna
Holly
be
will
there.
Be there by,
And-
I'll be there on Zoom.
I'll be there
so-
in some form.
So can we all give you our proxy if we? Isn't that what we? have to
Holly's
do?
not an executive
She's
committee
not.
member, so I don't think
Okay.
that will work.
All right.
I plan to be there on Zoom, so
Yeah.
I hadn't
And I'll
responded,
probably be there.
and I hadn't responded.
Not sure of the
I might listen.
freezing
in.
rain.
I have to go to Concord, but I just didn't want to have to go there.
Yeah, right.
The weather was.
And they send out do they send out a Zoom link only if you ask, or do they send it every time?
It comes with the agenda, I think.
Okay,
And when Kate sends out the ledge report, she usually includes it with that.
yeah, so that's that same link, I have that.
Snow up to 1 inch and the accumulation to 1/10 of an inch.
Yeah.
Where?
That's fine. The weather advisories. Portion of northern New Hampshire.
Oh,
So it may not. Can we leave our these things? Well, I'm just gonna put it on the
course you
desk in
can.
the other room, but You didn't want to carry them back and forth every time. This lady that will show up.
All right, and then I
Well,
guess we.
We
end
have
with
public comments if we're done with any other commissioner issues.
No.
All right, so we have somebody with their hand raised already, Emily Smith.
We're under that advisory. Julie.
Emily's,
She had her hand raised from early on in the meeting, so I don't know if she's still there.
PM to 10 a.m.
Ms. Smith, if you are wanting to speak,
She does take a second usually to unmute.
you can do that now.
The whole central part of the state.
All right, well, Mr. DeMeo has something to say, so why don't you go ahead?
Yeah.
and- Again.
Yeah, thank you. I know you had a lengthy meeting today. I've been on it since the beginning. Very disappointed that I wasn't notified that you had a meeting yesterday for the County Courthouse Building Committee. I think that came in at the last minute, and you may have met the letter of the law by putting it on 24 hours beforehand, but I think it would have been courtesy on your part. You know I'm on every meeting. I think it would have been very respectful of me as a taxpayer to alert me to the fact that that Jim Oakes was having a meeting with the architects, and I would have been in on that courthouse meeting. I think it was very disrespectful and non-representative of the taxpayers for you not to let me know that there was a meeting coming up on April 1st. That was a good joke, April Fool's joke on me. Thank you very much. The other thing that I'd like to make a point of is if you're giving level funded money to these organizations and then you all of a sudden subjectively give them $2,000 more or $4,000 more, then the cumulative effect over the years means that next year, if you level fund, you're going to go up to $22,500 for an organization where you gave them $20,000 the year before. So I think you should just go by the applications that they filled out and not be so subjective. I think it should be an objective thing that you're doing by looking at their application. And if they don't fill out an application and send it in, I don't think you're required to give them any money. I think that could lead to fraud, especially when you're audited. Aren't you audited on all these things? When you give out all this money, isn't there an audit done? I know with my committee, any monies that we have, our budget, it's based upon audit. So I would think that any monies you're giving away, anything you're doing here as an organization, giving away thousands upon thousands upon thousands of dollars is based on audit. And if you don't pass the audit, you could be held for fraud. And that's what's going on in our country today in Minnesota and California and all these other places. That's why we're all hurting for money. The taxpayers are hurting for money because there's so much fraud going on. Look what's going on in California with the train. Millions upon millions upon millions of dollars that a train was supposed to be built from Oakland to LA and it hasn't been built. And they joke about it. So I think you're leaving yourself open to fraud by giving away more money than they're asking for. And if they don't file an application, I don't think you should be giving them any money, no matter how good an organization it is. Thank you.
Perfect timing, perfect timing. Emily Smith, did you have something to say?
I did. I'm sorry, I couldn't click on soon enough before. My microphone doesn't always cooperate. So thank you
All right,
for
wait.
hearing from. Can you hear me now?
Yes.
Good. Insurance coverage for Grafton County employees is beyond what most citizens have. COVID and influenza A and B test kits, are they not covered? I believe they are. Therefore, we do not need to fund to stock some for in-house. Cut this in part of the budget. Have you as commissioners served to see what, or have you surveyed, excuse me, to see what the average citizen's insurance coverage is? Please do so, because our normal coverage does not cover Reiki. Why should the typical citizen in Grafton County cover Reiki for Grafton County citizens, let alone Grafton County residents to have Reiki? And I understand maybe it's beneficial, but first it should be beneficial to the residents, not to the employees. Now, pretty outdoor furniture, that's great. I'd like to have pretty outdoor furniture too. But it would be better to have outdoor furniture or outdoor things that a grant would cover, to have all residents be able to access the outdoors and fresh air, rather than just pretty furniture that some residents would be able to access. I want all residents to be able to access the outdoors. Also, I question, are the current alarms that you have in the Grafton County Nursing Home, are they alarmed direct to the Grafton County Correction or the Grafton County Sheriff's Office? And if not, why not? This is the first step. Forget about any other steps to expand what connections you have. Yes, I think you should delete. Who cares about connecting the financial office? You need to connect the nursing staff first.
Thank you, Emily. That's the time's up. Thank you for that. Is there anyone else online that hasn't had a chance to make a comment? Okay. Was there anything at this point? We'll close the public comment. Was there any that needed to be clarified or? Okay,
I move to adjourn.
Second.
all in favor?
Aye.
Aye.